At those moments I found those.
I'm touching the spirit. Okay. Yeah.
Yes, that's. And then.
Yeah, well, I guess next year, this year.
Holders can please take their seats. We'll get started in just one moment. Good evening, everyone. The hour of 6 o'clock having arrived on this 15th of July, 2025. It is my honor to call to order the City of Racine Common Council. First order of business is the Pledge of Allegiance. If you could please rise as you are able and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. President Horton, do we have any excused absences this evening?
Not at this time, no.
Okay, we do know Alder Fraser is appearing remotely, and the expectation is that Alder Allen may be appearing shortly remotely, and Alder Wagner may be late. So do we note it? Moving on then to the approval of the council proceedings or minutes from July 1st. Alder Wagner has arrived. Welcome. Approval of minutes from July 1st, 2025. Is there a motion to approve?
Move to approve.
Second. There's a motion to approve from Alder Horton, seconded by Alder Matt. Any discussion of said minutes? Seeing none, all those in favor, please say aye.
Aye.
Opposed? That motion carries. So we do have one proclamation and a bit of a reminder. So next 2 weeks from now, when we usually get council night, is actually National Night Out. So we are meeting Wednesday of that week, just a reminder for people. So this is the last opportunity for us to do proclamations ahead of that event. Therefore, it was important to read the proclamation that we do jointly every year with the county executive. It's an official proclamation of the county executive and the mayor of the city. And it reads, whereas the National Association of Town Watch is sponsoring a unique nationwide community building campaign that promotes police community partnerships in crime, drug and violence prevention programs on August 5th, 2025, entitled National Night Out. And whereas the 42nd annual National Night Out provides a unique opportunity for the Racine community to join forces with thousands of other communities across the country in promoting cooperative police community crime prevention efforts and positive police community relationships. And whereas Racine Neighborhood Watch Incorporated plays a vital role in assisting Racine area law enforcement through joint crime, drug, and violence prevention efforts in neighborhoods and in the Racine community, and in supporting National Night Out 2025 in the Racine community for the 42nd consecutive year. It is essential that all citizens living in Racine and the broader community be aware of the importance of crime prevention programs and the impact that their participation can have on reducing crime, drugs, and violence in neighborhoods and our community. And whereas police community partnerships, neighborhood safety, awareness, and cooperation are important themes of National Night Out and Racine Neighborhood Watch. And whereas National Night Out is designated an official county event by Racine County and a city event by the city of Racine, now therefore, the county executive and the mayor of the city proclaim Tuesday, August 5th, 2025, National Night Out. We encourage everybody, if they have an opportunity, we usually have dozens of National Night events throughout the city. Please find one in your neighborhood and attend. We'll now move on to public comments. I will ask the clerk to read the procedure and call those here to testify.
Public comment segment is an opportunity for citizens to speak directly to the common council. Speakers will limit their remarks to 3 minutes. There shall be no dialogue or interaction between the speakers and elected officials or staff. This time is not intended to be a debate or discussion. The common council shall not hear personal complaints or attacks against any city employee or elected official or any matter related to an individual claim, citation, appeal, or lawsuit. Profane, disruptive, threatening, or conduct that otherwise impedes the safe, orderly, and effective conduct of the common council meeting is equally unacceptable during the public comment period, as it is during all other portions of city meetings. When one group of people representing one viewpoint wishes to address the council, one person should be designated speaker for the group. Candidates for public office may not use this opportunity to campaign for office. Speakers during the public comment period shall follow all rules of the common council and rulings of the chair, including a decision to terminate the remarks if the speaker does not adhere to these rules. Public comment shall be limited to ideas or concerns regarding the city of Racine. There will be 6 speakers this evening. The first is Diane Kowalski at 5101 Wright Ave.
And before the first speaker comes up, just a reminder to everybody, everyone gets up to 3 minutes. When your 3 minutes are up, that is when your time ends. It's not a critique of what you're saying, but an effort to treat everybody equally and give them up to 3 minutes.
Hello, I'd like to address the council on 2 points. The first is public access, and the second is awareness of mutism. On public access, there are 2 topics I'd like to address. One is the crossing crosswalk area of Wright Avenue and Ohio Street near the apartment building where I live by the Starbucks school. It has become quite perilous, and I'd like to suggest if there's some way that something could be put that makes drivers aware that it is a school zone to drive better. I noticed that the corner of Washington Avenue and Ohio Street, there's some sort of camera. And when drivers see that camera, their driving habits have much improved compared to when I used to wait there to take the bus in the past. So some sort of camera, visual presence, or even maybe just the officer partially present, and those drivers do improve their habits. The second point of public access is regarding, I found out that the new social security office has moved from Grand Avenue all through the state, 132 something drive. Based on the bus system, as I understand the schedule, the bus only runs to the Renaissance Center, IMED Center, which is about 94th Street on a limited schedule, and there isn't any other service out there when someone can get a medical ride, taxi, or Uber. But even a taxi or medical ride is $25 on the trip, which for many of us on Social Security disability round trip would be 5% of our budget. Or to put it to a family who's, 4 families who are working, it's equivalent to $200 on their budget. And many people in this country even have trouble affording an unexpected bill of $400. So I hope something is done to improve it so that bus access can be done, because sometimes it is hard to get medical access all to certain places, even to our doctor's appointment. I sometimes have to take the bus off the breaker. The second major point is about to address mutism. Mutism are people who are afraid of social settings. Sometimes they're known as social introverts, lungfish introverts, things like a lungfish. A lungfish can exist as a mammal on land for a short period of time, but then needs to go back to the water. That's the same as people with mutism. I have partial mutism, but I have full mutism still in answering the telephone. So when people call me, I just have to tell them, Please leave a detailed message, I'll call you back. Once I become familiar with the number, I'll be able to answer on the first ring, but. In public speaking and education, I have selective mutism. Due to educational psychologists at the University of Phoenix at Volume graduate with a cum laude and as an MBA and a continuing doctoral program as a summa cum laude. But I think educational psychologists are needed on this issue.
Please include your rumors. Thank you.
The next speaker is Michael Nikolai, 2137 Neptune Circle.
Good evening, Mayor Mason and esteemed members of the Common Council. For those that don't know me, my name is Mike Nicolai, and I've had the honor and privilege of serving this, I'm the Secretary Treasurer of Local 321. Tonight I stand before you representing the dedicated men and women of Racine Firefighters Local 321 concerning the changes affecting our health insurance. Firstly, I would like to acknowledge the efforts of Amelia and her team who are working hard to find ways to save money for both our members in the city. Her commitment to cost savings is not going unnoticed, and we appreciate the focus on financial responsibility. However, I must express my deep concerns regarding the selection of Centevo as our new healthcare provider. While I understand there may have been reasons for this choice, it is evident that there are significant gaps in the information we currently have. For instance, the Centevo website lacks many doctors from multiple health systems. Just for an example, under Ascension, there is no pediatric doctors listed. Which raises serious questions about our accessibility to our members and their families. Moreover, we face uncertainty regarding which providers are covered under this plan as we navigate these changes. It is critical that we have clarity, not only about premiums, which we now know are negotiable, but also about the network of specialists available to our members. Many of our members and their families are currently under care by specialists, and the absence of clear guidance on this matter is troubling. Additionally, I would like to bring to your attention that you are being asked to approve a communication to allow the city administrator to bargain for a successor agreement tonight. However, the city is currently failing to adhere to the Wisconsin Employment Relations Commission, also known as the WRC ruling, to complete the now unsigned and expired 2021 through 2024 contract with Racine Local 321. This situation complicates our negotiations and raises concern about the future of our labor relations. Before any further decisions are made, I respectfully request that we take the time to gather all information that's necessary. Let's address these gaps, preventing potential issues that could arise when promises are not kept. In conclusion, I ask for your support in advocating for a careful and informed approach to these changes to our health insurance coverage and sign the contract according to the WRC ruling. Together, we can ensure the rights and well-being of the members of Racine Firefighters Local 321, as well as the rest of the city employees are protected. Thank you for your consideration.
The next speaker is Mark Bolitsky at 6923 Prince Drive.
Good evening. Here to speak to you again this week. After last, what was it, 2 weeks ago when we were here? And you guys rejected a development project for a gas station and a convenience store over a period of time. This week, we're being asked to consider Woodman's application, which is also asking for a geographical exemption. Now, that's kind of hypocritical. Do you not believe that people who are already invested in your community deserve a license and an opportunity? Now, I recognize that Woodman's is likely to get approved, no problem. I support that. But I don't think you guys should be picking winners and losers. Especially when people have already made a commitment to your community. And they have numerous properties and they've made a significant investment. As Alder Perez had pointed out, they employ over 200 people in their city. They own over 49 properties. You guys said no after voting unanimously. It's absolutely hypocritical. And it's very disheartening. We gotta quit picking and choosing winners and losers. When people come to you and ask for your assistance to try and help better your community, for God's sake, let them. Use your good sense. Please. Thank you.
The next speaker is Wang Zhu, and I will need an address when you come up, please.
So.
Speaking to the microphone.
Yeah, I know you. So my English not so good, please,
I'm still again. So last week, I come here, so maybe it's answer question, not so good, or it's some reason, so they, delay my license. So I started here and ask you guys to support and help me to get a license tonight, okay? So I think this question is, so why have the, formation? So the formation online, I never do the formation, I bought it business, I don't do formation. And I didn't ask someone to Google, so help me to Google, and I have a text message, my phone, you can see anytime, so I say, don't not girls, don't not pretty girl, don't say any words, just for Google. That's for my, advertising, I don't do any commission. So that's why they say why delays, because have the commission for many years ago, it's for other person, it's not for me, so I just bought a new business. I do my new, I listen to new, okay? So ask you guys, forward and, well, I will not do that commercial for any other bad stuff. I just put up Google, names nuggets, the Google and put up, it's an open, close all time, what kind of is that, pricing. That's. I think I'm standing here, that's okay, you guys people ask me any question, I'm happy to answer all the questions. Thank you, thank you everyone.
Thank you.
The next speaker is Joey Legat, 4 Gaslight Drive.
I'm legally blind. I live at 4 Gaslight Drive in Racine. I've been in Racine since 1966 with my father. He opened up a George Webb's in the Uptown. He was a retired police officer from Milwaukee. He had many businesses in Racine. I have many businesses in Racine County area. I employ 130 people. I believe in downtown Racine. I believe in Racine. I love Racine. And I hate to bring this up because I hate to have people think that I'm saying this because I donate money. And I hate that, but I'm gonna bring it up. I've donated a lot of money to downtown Racine. My wife and I donated $5,000 recently for the Christmas stuff. I live downtown. I have a building downtown, I have a yard downtown. I bought the yard arm because I believe in downtown. Before COVID started, we were really on a roll. And now we need to be on a roll again. So we need help. And by help, I mean you need to change Highway 32. I understand the mayor doesn't want that, and I have respect for the mayor's position. I do not like that the mayor got booed on the 4th of July. I think that's not nice. It's the 4th of July. Let's have a great time. He's got his wife there, he's got his kids. So I'm gonna say that because it bothers me and I'm not on the list, but I don't care. So the Main Street thing, could you imagine if we had stop signs? We would have so much less busy traffic. We would have people stopping, maybe they'll look and say, oh, wow, I didn't know that store was there. Hey, let's go in there. Hey, this is a safe area. Look at, they got stop sign. And you can, be free as a pedestrian. You don't have to worry about whether the lights work or whether they're gonna change in time. And highway, in our downtown, we do need this. We do need a boost. This is the time to do that. I have no idea what my time is, but I'm gonna finish with the fact that we all are responsible for what happens in downtown as citizens, as business owners, as aldermen, as a mayor. I want this to be slow. We took out Metro because we're gonna pay for off-duty police officers on the bid board. And yes, I like Brett for Metro, but we took care of that. It's $18,000. We're willing to put $18,000 in off-duty police officers. I would love the fact that if an officer came into a bar.
Your time's concluded, sir.
I'll be back.
We'll see you next time.
Oh, absolutely. I'm not done till I get my weight.
The last speaker is Bruce Carter, 2307. I believe it says Britton Drive. I apologize if the address is wrong.
That right. That's correct. I didn't think I'd come back and speak before this council. Cause I saw the little purpose. But I continue to get these calls when things don't go right in the city that I don't even live in technically. I've been here 8 months trying to see how you create a pathway. I visited the centers. I currently work with young men from this community now. Some can't read and write, is 15, 16 years old, but they're being socially promoted. That's gonna take you to crime. I currently volunteer at RIAC every Wednesday. I have young men from Racine and from Milwaukee. 60% of that prison is young Black men. Yet this population is 6%. If I look around here, where's the representation? I visit your, put the guns down. I visit with old people from here who says there's no hope for Racine. I visit with people that work at the county and the city that says, no, there's no hope for Racine. I've been New York, Memphis, Atlanta, Philadelphia, Dallas, Houston, Chicago, Mississippi. I've never in my life experienced what I've seen here. I have young men who will not go to the north side because they're from the south side. People from the south side will not go to the north side when I can drive this city in 20 minutes. And lo and behold, if they meet in the middle of the city, what's gonna happen? But yet, I haven't heard anybody talk about the violence today. It's so common. I just wonder if the behavior starts to have shootouts at North Beach, what will happen? And stray bullets happen not to catch another Black person, what would happen? What would happen? Will we take it serious? Maybe not. But I think you would, because that whole library would be filled with opposition. The people here, I'm talking about Black people, have been beat down so bad that they don't see that there's light at the end of the tunnel. And where there's no hope, there will be no civility. That's a guarantee. And I don't know who in this city has the courage to realize that whatever we've been doing, it's not working. I've heard people say, he's not even from Racine. Maybe you need a different perspective. Because what you're doing now, what you've been doing, it's not working. The buddy system doesn't create change. People do.
This concludes the public comment segment.
We now move on to communications introduced to council. Alder Land, would you like to make a motion regarding the items referred to finance and personnel?
Like to move the following items, refer the following items to finance and personnel. Item 0702-25, communication sponsored by myself on behalf of the city's attorney's office, submitting the claim of acuity for consideration of disallowance. Item 0704-25, communication sponsored by myself on behalf of the attorney's office, submitting the claim of the estate for Joseph Lee for consideration for disallowance. Item 0703-25, communication sponsored by myself on behalf of the Departments of Park, Recreation, and Public Services, submitting bid results for tree stump removal and restoration. Item 0710-25, communication sponsored by Mayor Mason and Alder Mack on behalf of the Downtown Racine Corporation, requesting permission to close Main Street and State Street for the party on the pavement September 20th of this year. Item 0711-25, communication sponsored by Mayor Mason, authorizing the Assistant Executive Director of Community Development Authority to access funds from the City of Racine Brownfield Cleanup Revolving Loan Fund. I move to move these items to finance and personnel.
Motion to move these items to finance personnel. Is there a second?
Second.
Seconded by Alder Horton. All those in favor, please say aye. Opposed, that motion carries. Alder Mack, would you like to make a motion regarding the items referred to Public Works and Services?
I'll make a motion to refer the following items to Public Works and Services. First item is 0699-25 communication on behalf of the Department of Public Works, submitting final payment for 2024-165-224 sidewalk replacement AWO contractor. 0700-25 communication sponsored on behalf of the Department of Public Works, submitting change order number 2 to contract 2024-165-224 sidewalk replacement. Next item is 0701-25 communication sponsor on behalf of Jonathan Shop Corporate Facilities, CNH requesting permission for a private utility in the city right away from 700 State Street to 705 State Street. 0705-25 communication on behalf of the Department of Public Works, submitting bid result for contract 2025-385-225 sidewalk replacement. Next item is 0707-25 communication on behalf of Dolores Williams, ANS Unlimited Solutions, requesting to close the intersection of Quincy Avenue, Grange Avenue, and 19th Street from 4 to 9 on Friday, August 22nd for the annual Back to School Vacation Bible School celebration. 0708-25 communication on behalf of the Department of Public Works, submitting bid results for contract 2025-125-CDBG Rapids Drive Lighting. Next item is 0709-25 communication on behalf of the Transit Department, submitting change order number 2 on contract 2024-109 Transit Center renovations, KPH Construction Corp. Contractor. Next item is 0710-25 communication sponsored by Mayor Mason and myself on behalf of the Downtown Leasing Corporation, requesting permission to close Main Street from State Street to 7th Street, 6th Street from Lake Avenue, Grand Avenue, Wisconsin Avenue, from 4th Street for party on the pavement on September 20th.
There's been a motion to approve these items. It was seconded by Alder Perez. All those in favor of moving these items to Public Works and Services, please say aye. Opposed, that motion carries. Alder Weidner, would you like to make a motion to refer the listed items to Public Safety and Licensing?
Before I do that, I have a question for either the city clerk's office or for the city attorney in regards to one of the items that are submitted for referral, and that would be item 0674. In regards to the petition to exceed the geographical and photo restrictions for a Class A retail fermented beverage and intoxicating liquor license. Question is, should this go to public hearing prior to the previous item listed? And should that public hearing go before the Public Safety and Licensing Committee at the same time we are discussing those applications?
I'll refer your question to the city clerk.
I can start, maybe Scott can correct me if I'm incorrect on any statement. So I believe the public hearing by state or by ordinance must take place in front of the common council. So the item will still go before the public safety and licensing, but the public hearing must be noticed for the common council in order for it to be approved or denied at that meeting. So I know that that part has to go there. The item itself will still go to public safety and licensing, where the discussion on whether or not to recommend approval or denial of the exceedance will still go before public safety and licensing and receive the recommendation from the committee. Did that answer your question?
Well, sort of. Being that's a rare occasion when we exceed the geographical boundaries. Should this go to public hearing before the Public Safety and Licensing Committee discusses the application for the intoxicating liquor license?
I'll ask the city attorney to correct me if I'm wrong. I don't believe that there is an order listed out, so it would be up to the common council at this meeting to determine whether or not you're referring it to public safety and licensing or referring it elsewhere.
I'll ask the city attorney if he wants to weigh in on
I just agree that ordinances don't require a specific order for these actions to occur.
So all three items can go to the PSL at the same time? We can discuss granting the license prior to the public hearing without having heard from the public?
Yes. Yeah.
Okay, thank you. I would make a motion to refer the following items to the Public Safety and Licensing Committee. First item being 0672-25, communication for a new application for a Class A retail permitted malt beverage and intoxicating liquor license and a cigarette, tobacco, and electronic vaping device retail license for Woodman's Food Marts, Inc. DBA Woodman's Food Mart. Item 0673, communication for a new application for a gas service station and a cigarette, tobacco, and electronic vaping device retail license for Woodman's Food Market, Inc. DBA Woodman's Food Mart, Inc. Item 0674-25, communication for a new petition to exceed geographical and photo restrictions for a Class A retail fermented malt beverage and intoxicating liquor license for Woodman's Food Market, Inc. DBA Woodman's Food Market, Inc. Item 0687, communication on behalf of the City of Racine Police Department for a licensed premise report. Item 0688-25, communication requesting any consideration, any formal expression of concern or other action pursuant to the police report. Item 0713-25, communication on behalf of the Public Safety and Licensing Committee requesting the appearance of Kayla M. Dibble, agent for Kayla Neighborhood Bar LLC, located at 2054 Lathrop Avenue, pursuant to a formal expression of concern and also requesting consideration of rescinding that formal expression of concern. Item 0714, communication on behalf of the Public Safety and Licensing Committee requesting the appearance of Rebecca A. McCray, agent for Taste of Soul Bar and Grill LLC, Taste of Soul located at 501 6th Street, pursuant to a formal expression of concern and also requesting consideration for rescinding the formal expression of concern. Item 0689, communication on behalf of the clerk's office requesting the appearance of Jesus Cortez for a new operator's license, 4th District. Item 0691-25, communication on behalf of the city clerk's office requesting the appearance of Peter Marcotte for a new operator's license, 10th District. 0693-25, communication for a premise description change for 20 Grand Lux LLC, 20 Grand Lux, located at 1307 Douglas Avenue, Fort Meade, Marshall, 4th District. 069625, communication submitting a renewal application for a 2025-2026 motor vehicle towing license, Johnson Towing DBA Johnson Towing, located at 2625 Meadow Road, 6th District. Item 0695-25, communication submitting an application for a new Class B fermented malt beverage and intoxicating liquor license for Parlays on Main LLC, located at 240 Main Street, Alexa Gaze Agent, 1st District. Item 0627-25, communication submitting a new cigarette, tobacco, and electronic vaping device retail license for Zach's Vape and Smoke LLC, located at 1743 State Street, Pam Dave Farag, agent. I believe this is the 6th District. Item 0698, final item is communication submitting a new renewal application for the 2025-2026 motor vehicle towing license, Racine Recovery LLC, DBA Racine Recovery, located at 2817 Eaton Lane, 7th District.
Second. Been a motion and a second to refer these items to Public Safety and Licensing. All those in favor, please say aye.
Aye.
Opposed, that motion carries. We now move on to committee reports. The reports from all the land. The first thing we have is a presentation from the Human Resources Department to explain the first item on the agenda. Please, the council, I would ask HR staff to please approach the meetings. Amelia, you have the floor.
Thank you for letting me present this evening. My name is Amelia Rosso. I'm the benefits manager here for the City of Racine Human Resources Department. For this item, as an introduction, in September of 2019, the Common Council approved the city to implement a high deductible health insurance plan for all eligible employees and pre-65 retirees effective January 1st, 2020. Since that implementation of the high deductible health insurance plan, the feedback and concerns that I have received have mainly revolved around number one, having a choice in that having one high deductible health plan is, limiting. And two, lower cost overall, so employees wanting lower out-of-pocket deductible amounts, lower premiums and lower costs for prescriptions. And for the proposed changes that I'm looking to make, I would like to move from United Healthcare to Centivo as our third-party administrator. Centivo offers the city an opportunity to take action on the feedback that we've received and offer 3 health insurance plans, one of which being rather richer than the high deductible health plan that we have in place today. During the month of June, I presented on these changes to all city departments and scheduled open office hours for one-on-one meetings, all of which totaled 51 presentations. Based on the feedback that I've received from employees, from these presentations that I've conducted, today is the final proposal of the changes that I would like to make to the medical insurance for approval by the common council. So with that, I am going to hand it over to Matt from Centivo, just to give a very brief overview of who Centivo is. And then after that, I will review the proposed medical insurance plan offerings.
Good evening, I'm Matt Katz from Centivo. Appreciate the council's time this evening to allow us to present just a short few minutes of who Centivo is. I believe there will be an opportunity for some questions if needed. Centivo is a new type of health plan. We work with self-funded employers throughout the country. We were brought into the market here in Southeast Wisconsin through a partnership with a coalition of employers called Business Healthcare Group Coalition. Centivo's mission, while there are lots of problems with healthcare in this country, the primary focus for Centivo is to address practical affordability for the average American worker in this country. We are founded on really 2 core elements. One is the recognition that healthcare providers are built differently in terms of cost and quality. Unfortunately, in healthcare, there is no correlation between cost and quality, meaning if you simply pay more for healthcare, that you get better quality. And so Centivo's mission is to go into markets like Southeast Wisconsin and identify high value providers, those providers that meets high quality outcomes first, and then look to cost metrics after that. So Centivo has built networks around high value providers. That is, the core elements of Centivo. The second portion is really anchored on a strong primary care relationship. So each of our members selects and works closely with a primary care physician. We believe that the best outcomes come from those that work closely with a doctor and not having insurance company managing people's healthcare. That's a full partnership between our patients, our members, and their primary care doctor. We offer a lot of different access to primary care physicians. We have contracts locally with both Aurora, Ascension, other providers like Children's Hospital, Freighter North, Pro Health, and lots of others. And when we do that, we see a significant amount of savings, both to certainly employers and members, where we see the average member of Centivo spend less than $250 a year on their healthcare costs. In addition to our employer clients also save in the range of 13 to 18% on costs. I think with that, I think we're gonna share some numbers.
Yes. So each member of the common council should have received this handout. At the top, it says point of enrollment choice for employees. So I'll be referencing this throughout my presentation. For both active employees, I am looking at offering both the high performance copay plan, which is the first column with the orange header. You'll see it says high performance copay plan WI-2. And I am also looking at offering a high performance high deductible health plan. And those are the other 2 columns that have the orange header. You'll see high performance HDHP WI-2 and then high performance HDHP WI-1. The high performance, high deductible health plan. Both of these, they're the same plan design, but they have different networks assigned to them, which I will touch on the network piece in just a moment. But as far as plan design, this high deductible health plan closely mirrors what we offer to this day. This plan would have a $3,500 deductible for a single level of coverage and a $6,400 deductible for family, with a $4,000 maximum out of pocket for individual and an $8,000 max out of pocket for family. And this high deductible health plan, this would still be compatible with the health savings account. The high performance copay plan is more of what one would consider a traditional health insurance plan. This is a new plan that I'm looking to offer. There would be a $200 individual deductible and a $400 family deductible. Once these deductibles are met, there would be co-pays for the specific services that are listed in this column, such as outpatient surgery, inpatient hospitalization, urgent care, and so on. Under the co-pay plan, visits with your primary care provider would be at no cost to the employee. So whether or not an employee has met their deductible, no matter what type of visit it is with their primary care provider, whether it's a sick visit, a medical concern, a wellness visit, and so on, all of that would be free for the employee throughout the year. Prescription coverage under this copay plan would be in effect immediately. The difference between this and the high deductible health plan is with the high deductible health plan, employees are currently paying 100% of the cost of their prescriptions until their deductible is met. For example, under the high deductible health plan I'm proposing for 2026, that would be that $3,500 individual deductible. With this new copay plan, I'm looking to introduce those copays under the RX column, those would kick in right away. So the most that one would pay per prescription would be $150, and that's for specialty. The out-of-pocket maximum for this copay plan would be $3,000 for single level of coverage and $7,000 for family level of coverage. So again, between the deductible, the prescription coverage and the out-of-pocket maximum, this is a richer plan than we would see with the high deductible health plan. The standard high deductible health plan, which is the last column that has the black header all the way to the right. This would be the plan that I would be offering to pre-65 retirees and employees that do not live within Centivo's network. All of the orange headers, all of the plans that I just reviewed outside of the standard high deductible health plan, I would offer all of those plans to pre-65 retirees who live within Centivo's network. For both the high performance copay plan and the high deductible health plan, you will see under the column that says PCP and referrals required. All of the three plans with the orange header say yes. The concept being that these plans will be more, as Matt touched on in his introduction, will be more of a primary care physician focus and model. We essentially want individuals to be connected to their primary care physician, who will help the individual navigate their health and wellness needs. And their PCP will be the one to make referrals if they find a necessity for employee. So another bigger change that we would see if this were to be implemented would be under the network row. So you'll see for the copay plan, and the second column, the high performance high deductible health plan, it says WI-2. And for the high deductible health plan, it also says WI-1. If you flip your handout over, you will see a map along with two boxes. The WI-1 network and the WI-2 network include the medical systems that are listed in their respective boxes. And the orange highlighted area on the map encompass all those major medical providers that are listed in these boxes. The biggest difference between the two is WI-1, this includes Aurora Healthcare. WI-2 network does not include Aurora Healthcare. In addition to that, Freighter itself is not included in either WI-1 or WI-2. So Centivo is having conversations with Freighter itself right now about including them in a network, but I don't anticipate that they would end up in the network by 2026 if this were to be implemented. So as of today, Freighter itself is not included in the network. That is just the freighter that's in Kenosha. Other than that, Children's, Freighter, Mercy, Medical College of Wisconsin, Pro Healthcare, Ascension, Independent Physicians Network, SSM Health, George County Medical Center, and Fort Healthcare are included in both WI-1 and WI-2 networks. So just to reiterate, the high performance co-pay plan will be assigned to the WI-2 network. And the high deductible health plan will be offered under both the WI-1 network and the WI-2 network. The HPS network run by Cigna that's assigned to the standard high deductible health plan is a broad network that closely mirrors what we have with United Healthcare today. So that is why I would offer that to pre-65 retirees and employees that lived outside of Centivo's network. A couple of questions, with that being said, a couple of questions that were posed to the owners that I would like to address. Is the first being about premium amounts. So our premium development is done through our benefits and consulting for Brown & Brown. Today I have Julie Sosnay here and she's going to come up and speak about the premium development for 2026 with the proposed Centivo claim designs.
Thank you, Diane. Good evening. So I want to start the conversation by saying we're a little bit early in the year to fully predict costs for 2026. So we have preliminarily put some numbers together. So I won't tonight give exact dollar figures, but at least a range of what this might look. So that everybody is aware. So with the Centivo networks, what we would be looking at for employee contributions. That Wisconsin 2 network that Amelia mentioned that executes Aurora would be a bit of a decrease from what employees are contributing currently to that plan premium. So again, I don't want to say specific numbers because these will change, but from a couple of dollars to low double digits. Again, these are subject to change, but just to give you an idea. On the Wisconsin 1 network, that does include Aurora, we'd be looking at a slight increase to current contributions. Similar in range from a couple of dollars up to, maybe teens-ish. And again, that's depending on single or family contributions. If we remained with United Healthcare, the projected increase to the employee contribution would be greater than what we'd be seeing with the Wisconsin 1 network under Centivo. So that we're looking more at the, maybe low single digit or low double digits for single, getting into, potentially 20, 30-ish dollars. And sorry, this is a monthly basis, not per paycheck, but per month. Okay. Again, all those numbers are subject to change, but to give you an idea, again, the intent, like Amelia said, is, to offer a plan where plan costs and contributions would be lower than under the existing arrangement, so that would be that Wisconsin 2 opportunity. Wisconsin 1, just a slight increase from where we are today, and then if we remain with United Healthcare, that would be the highest option, cost option.
A couple of other questions that were posed to others, mainly around, revolved around network. So essentially asking if there were restrictions within the medical systems that are listed in WI-1 and WI-2, as well as what would happen if individuals currently being treated by a specialist that's considered in network with United Healthcare, but then would be considered out of network if we were to move to Centivo. There's a couple of different points to those questions, and because of that, I do want to bring up Matt again from Centivo just to briefly touch on a solution for that.
Yes, thank you. So given the options that are in front of staff currently, what's certainly being proposed. Again, we are including the 2 large hospital systems here locally, both at Aurora and Ascension. In terms of the specialists at either one of those hospital systems, I'm going to use those as examples because they are the most local examples between Aurora and Ascension. All the specialists that live inside those hospitals are in our network. The only opportunity where there could be some slight disruption is on the primary care side of things. We look at individual, performance of doctors, particularly on the primary care side, of healthcare. And so we do suppress about 15% of primary care physicians within the walls of any of those hospital systems that were mentioned due to cost and quality metrics. So these are physicians that have, underperformed, in terms of standardized, criteria. And so there could be an opportunity where somebody could be seen a primary care physician that is no longer now accessible within those hospital systems. In the event, and this is a very rare event, but in the event that somebody needed care outside of the network, so we're talking about less than 1% of the time, where the local providers, whether it be Freighter or Ascension or Advocate Aurora, that may say the scope of services needed are beyond what these local hospital systems could provide. So that does happen on very rare occasion where a physician, a hospital may say this person needs to go to Mayo Clinic or Cleveland Clinic. As examples, we will do what's called a single case agreement. So we will work with that patient and their local providers to give them in-network access at a provider or hospital that may be outside of the network. I want to just reiterate that those are processes in place with us. So, you know, this is not something that somebody can just choose to go to Mayo Clinic. It has to be something that is recommended by the local network of Centivo providers. So usually it's the hospital systems working in conjunction with Centivo to take a look at someone's individual needs. If that care needs to be sent outside of the local area, we will again work with called a single case agreement to have that patient transferred to an out-of-network provider at an in-network basis. Outside of that, if somebody were to have an emergency, for example, and they're outside the service area, that is always covered at an in-network benefit. We also extend that to urgent care. So we use the example of someone's traveling or on vacation, you know, college kids that might be living out of the area. If it's an emergency, urgent care type situation, that's always covered at an in-network benefit. But again, there are rare instances where we do need to evaluate the care that is here locally, but that is again a very small number of incidents. That it?
Okay. And the last question posed was in regards to cost savings to the city if this were to be approved and implemented for 2026. As far as that question, I would like to defer that to Finance Director Kathleen Fisher-Smith.
Thank you, Amelia, and I want to say thank you so much for all of your hard work. It's been 2 years in the making to try to find a solution for the employees without significantly increasing our costs. In terms of cost savings, really what this plan would do would reduce our cost increase. There would be no overall savings to the city of Racine. Our increase would be less. So initial projections, if we stayed with UHC, if we stayed with what we are right now, our cost would increase for 2026 by about $2 million, maybe 2.5. Okay. If we go with the Centivo as proposed, our cost increase would look something closer to a $200,000 increase, which is obviously from a fiscal perspective, far more palatable. Keeping in mind that the city of Racine does have a structural deficit, which we keep talking about, but particularly the healthcare fund has their own structure. So the Common Council last year applied about $800,000 of fund balance to balance the healthcare fund budget. That in itself is a structural deficit of $800,000. So for example, if we would go ahead and keep UHC, we would go into 2026 with a $2.8, $3.2 million structural deficit in attempts to try to cover that in our regular operating budget, which is, to be honest with you, almost impossible at this point. So again, it's not going to be an overall cost savings. There's going to be no major windfall for the city of Racine, if you will. It's just a cost mitigation solution.
Thank you so much for your time tonight. That concludes the presentation that I have on the proposed changes for the medical insurance for the city. And I, as well as Steve and Brian Brown, are here to help answer any questions that anyone else might have.
Questions from individual alders, Alder Brents.
So we saw the numbers here on the different areas. But what does it actually cost, like per paycheck per family for the people that are getting insurance?
Yes, so that would be, what you're talking about is the premium contribution, the employee premium contribution per month. So as Julie touched on, we have very preliminary numbers at this point due to premium projections and amounts being based on a number of factors that require us to be further into the year. So meaning, claims experience, what happened with the medical claims that the city paid for the year, stop loss, what does that look like, administrative costs, things of that nature. So we're not necessarily far enough into the year to give you definitive number of premium amount numbers at this point. Preliminary rate projections, for the copay plan, the percent, it would go down about 6% in premium from what employees are paying today in monthly premium contributions. And for the high deductible health plan, on the WI-2 network, it would go down to about 7%. And then for the high deductible health plan for the WI-1 network, which is the network that includes Aurora, we would see around a 4% increase. So that is, we're talking anywhere between a $3 to $10 change. It wouldn't be a significant change to the monthly premium contribution.
Well, I was trying to figure out what Matt said, that they were working with the configurations. And look at the back with W1 and W2, and it's listing all the different hospitals. Does Centura then work with these hospitals? Or how are they partnering with these people? Or is it something totally different that they say, for example, if you're part of Centivo, then you could go to these places, or how does those combinations work then?
Yes, Matt is going to talk about that.
Yeah, so Centivo owns the direct contracts with these hospital systems. So like today, with the health plan, with United Healthcare, they own their own contracts with hospital systems. So much like that, we built our own networks. So these hospital systems that you see listed on the slide, these are contracts that Centivo holds with these hospital system providers. So staff and families are able to access any of these providers locally. We also are in 15 other states across the country. So we built markets similar to Eastern Wisconsin and other parts of the country. And those hospital systems are also part of that mix.
So you also mentioned that if they were not in the network, they would be considered in that Madison, he gets hurt, goes to urgent care.
Yeah. So if somebody were to be outside of the service area and it is considered an emergency, so think of car accidents, heart attacks, those kind of things. That is healthcare law that treatment is considered an in-network benefit. So someone's in Florida on vacation and unfortunately they're in a car accident and you get brought to a hospital, not in this network, it will be treated as an in-network benefit. We also extend that beyond ER, so we extend that to urgent care as well. So sinus infections, and guys, those kind of services. Somebody were to be outside of the area, traveling, college kids, what have you, that would all be considered an in-network benefit.
So do you do telehealth too?
Yeah, that's a great question. So we have two telehealth services. One is a primary care based solution that Centivo owns. So we actually staff our own physicians, practitioners, mental health providers, nurse navigators to operate a true advanced primary care model that's done virtually. So every staff and their families would have access to that care as well. We also use a third-party company called ND Live, and they're more of an urgent care virtual solution. So when you call ND Live, you'll get a different doctor every time, but it's for those more acute care items, the colds, the flus, COVID, sinus infections. So we offer two solutions to access care virtually.
Okay, Amelia, does this also cover retirees or is that a totally different program?
So this would be extended to pre-65 retirees. Post-65 retirees, would be if they're eligible, enrolled in the Medicare Advantage plan, which is not, part of these changes.
That's all they're eligible for,
Well, if they're-
post retirees?
They would be eligible for all of these options, depending on where, if they're in Centivo's network or if they're not. And then, post 65, they're Medicare eligible. If they're eligible for the Medicare Advantage plan, then they would be enrolled in the city's Medicare Advantage plan.
So you said too that, we don't know what the actual cost are gonna be right now. Does that mean that we don't know what the actual cost of the employee is gonna be, but you gave a range of $10 to $18 or something?
So we have preliminary rate projections based off of the claims experience and the data that we have available as of today. And those are the numbers, that I gave to you earlier. So the decreases can range anywhere from 6 to 7.5% for the copay plan and the high dose health plan that are on the WI-2 network. And then we would see a little bit of an increase for the high deductible health plan and the WI-1 network. It would be about 4%. But we don't have our final stop loss enrollment and we don't have a number of months of claims history and other factors that affect the premium amounts, because we're not far enough into the year yet. So these aren't final, these are just preliminary projections.
Yeah, so I get that, we're 5 months into a 12-year plan. But based on, and you're going based on the 5-month is, what is the difference? Projected difference in what they would have to pay? You set up the stopgap loss, right? Or stop loss gap, or you said?
Oh, stop loss, yeah, stop loss is separate. Yeah, I can give you the premium amounts that are projected as of today.
Do you have them with you now? or-
Yes, I can do that to you. Okay. So this is for active employees. I'll focus on active employees. For the co-pay plan on the Wisconsin 2 network, the single contribution would be $52.91 per month and the family would be $139.71 per month. And for reference, currently, single level coverage, the monthly premium is $56.65 a month and family is $149.59 a month. So it would be decrease. For the high deductible health plan on the Wisconsin 2 network, to reiterate, this is the network without Aurora. The single monthly premium would be $52.38 and the family monthly premium would be $138.31. So again, a decrease.
What about medications? We didn't mention, last time we talked about the different plans that are available for medication, nothing was mentioned this time. How was medication work?
Yeah, so medications, if you reference the handout that I gave you. Nothing essentially is changing with CVS Caremark being our pharmacy benefit manager and the pricing that they have for their prescriptions. The way we pay for that and when coverage kicks in is what would change under Centivo. So under the high deductible health plan, individuals would still be paying 100% of the cost of prescriptions until their deductible is met. Under these high deductible health plans for individuals, that's $3,500. And then after that, that's when the co-pays will kick in for prescriptions. So that's how it works to this day as well. With the new co-pay plan that I'm looking to introduce, these co-pays would kick in right away. So for example, for specialty, Trulicity, Humira, Skyrizi, you're easily paying $1,500 to $2,000 per prescription for those. Under this new copay plan, the most you would pay for specialty is $150 per prescription. So there'd be a significant impact in savings for employees.
So does that still include the Racine Employees Health Clinic or does that out of it?
Yes, so nothing would affect the Racine Employee Health and Wellness Center. That would all stay the same. So Centivo would integrate with the Health and Wellness Center where they would be able to select the nurse practitioners as their primary care providers. That would be the only change that we would see.
The medication costs would still be $0 or $10.
Correct.
for their formulary.
Correct.
And then outside of the formulary, the preferred place is CVS.
Correct. Correct.
Alder Lamb, do you have a question?
Yes, I have a couple of questions for Matt from Centevo. You said something about, not all doctors in the plan would be included, and we're talking about Freighter, Aurora, and Ascension, that some primary doctors are not included, even though they're at those institutions.
Yeah, I wanna back up and just kind of explain the process. So under the Centevo model, there is a process called activation. So when our members get their ID cards on the first of the year, the first thing they're prompted to do is select a primary care physician. It could be a virtual one that we discussed, it could be the near site clinic, it could be any number of in-person providers here in Racine or, you know, locally. It was vitally important for Centevo and the Business Healthcare Group to understand, is every primary care physician a good one? And just like every other industry, there are really, really good ones and maybe not so good ones. And so there is a study that's commissioned every year by the Business Healthcare Group that looks at individual physician performance. And there is about 15% of primary care physicians only. So we're not talking specialists, primary care physicians only. That were rated in the bottom half, the bottom quadrant of quality outcomes, based on standard medicine, criteria. And those primary care physicians will not be, while they're contracted with us, they're not accessible to choose when somebody goes to activate their health plan, which is again, simply choosing a primary care physician. Now, in the instance where your selected primary care physician might not be available that day, for application, they don't have appointments. We do allow members in a coverage type situation to see that physician. So if you're sick one day, you want to go see your primary care doctor, they don't have appointments that day, they're on vacation, but Dr. Smith next door, who wasn't one of the qualifying physicians, can see you, you certainly allow that. But on a regular day in and day out, primary care management perspective, we want folks choosing doctors that quite frankly have met at least minimum standards of quality.
Well, then my question would be, before the employee chooses, I mean, because I really like my primary doctor and if he told me he was bad, they would let me off. But, you wouldn't say that, but, would they be able to see before they make their choice if their doctor is in there?
Yeah, so that directory site has been live now for a few weeks, so we've allowed staff to go out and start to look. I will caution, our directories, and I work for all the major health plans around here, those directories are only as good as the data we get from the hospitals. So sometimes that data is bad, sometimes hospitals don't want us to publish a certain physician because they have a full patient panel or whatever it may be. So I know there were some comments made, tonight, if you're not finding the doctor that you think you should find, we're happy to take those questions and we can look into it, deeper. It's either gonna be one of two things. One, it's bad data from the hospital systems, or it's one of the, again, 15% of primary care physicians across the board that, again, didn't meet those quality standards. So we're happy to take those questions if you're not finding your doctor. Any specialist, so anything, any lipologist, right, at Aurora, Ascension, Freighter, any of the hospital systems we discussed are accessible, they're in the network, we don't do any suppression of specialty.
I have another question, and you explained this at the finance and personnel, but I would like you to clarify for everybody that if somebody, I think you used the example of a pregnant woman, but I want to change it to an example of someone with cancer or other terminal disease that's already being treated as somebody you consider out of network. Will they be able to stay there and continue their treatment there?
Yeah, so understanding that folks might be dealing with sensitive, health concerns. There is a list of criteria, okay, it's not everything, but there is a list of criteria where, for example, if somebody wanted to take the, $200 deductible plan, because it's a good value plan, but they're currently seeking treatment at Aurora for a specific disease, and you have a list of that, right? So you mentioned, if someone's in their second or third trimester of pregnancy, but advanced, cancer treatments, mental health providers, so there are a short list of conditions that would qualify somebody to continue their care at an out-of-network provider at an in-network benefit until that patient can be reasonably transferred over to an in-network provider. So that's really up to, the hospital system and doctors. It's up to our staff that look, I'm not qualified to decide that, but we have very qualified folks that will work closely with the hospital system to determine if and when that patient can be transferred over to an in-network provider. But in some instances, rare, but some instances, those things that I mentioned, and some others where we do allow that continuity of care.
Otherwise,
Thank you. I received some emails and some text messages from current employees who want to remain anonymous. For many reasons. One of the statements that was made, and maybe this is for Kathleen, I'm not really sure, is that the city used to have a third-party company called the Horton Group that helped us shop for the right insurance. We no longer use them, and now we've gone with a benefits manager. And from this person's perspective, she said that's fine for in-house administration, but likely lacks the knowledge of the insurance market as a whole, since we don't shop for insurance frequently. That led me to, that statement led me to the question was United Health approach for offering a low deductible along with the high deductible that we currently have?
Yes, so two parts to that, Brown and Brown Benefits Consulting Firm,
Okay.
that's who I work with today. They're like the Horton Group, but they're not the Horton Group. They're a different benefits and consulting firm. So I just want to clarify, we do work with a benefits consulting firm. I've vetted a lot of options, including United Healthcare.
Okay.
And as Centivo, I'm presenting this today because of this is the richest plan that I could offer for our employees that addresses all the concerns that I've received in years I've been in this position. At a fiscal point that Kathleen touched on, that I can move forward with, if that makes sense. At a point of being fiscally responsible for the city as well.
Okay, then another comment that was made is that many fellow employees that this person spoke with said felt like the presentation from HR was more of how would you feel if we switched this company? And that was the sense that I had when I attended the first finance committee, that I didn't think that this was something that we were going to move forward with so rapidly. I thought there was going to be more of a survey or understanding that these are the options. Do you want to go with Centivo or should we stay with what we have? Now I get the feeling that because of the fiscal cliff that the finance director has mentioned, that we have to go with with the Centivo to save money from the health fund.
If I can speak personally, I have been working for a number of years to try and address the concerns, so many concerns that I've received from employees about what I expressed at the beginning of the presentation, mainly focusing on how it's such a physical impact on employees' lives for the high deductible health plan. I have stories of individuals, calling me and saying, I have a prescription I really need, but it costs $2,000, like I don't know what I'm going to do. Or employees who may be fighting cancer, who are in and out of work and, trying to figure out how to pay their medical bills. And I have stories like this, not stories, real life situations happening for employees that I've been hearing consistently since I've been in this role, starting in 2021. And my personal focus, yes, fiscal is an impact, but mine is I just want to help. I want to help our employees. And I've been knocking on Kathleen's door and Scott's door and Mayor's door for years, Truly, that's truly me talking, because I just want to help these human beings. So I know it seems like it's happening fast. When I presented to finance and personnel in June, I tried to reiterate the fact that, you know, this is what I'll be asking our employees their feedback on, for the month of June, so that I could come back, and ask if I can move forward with this. But their feedback had an impact on what you're looking at today. I listened to that. I listened, it wasn't written in verbal form. And this is what I have for you based on, you know, expertise from Brown and myself and administration, as well as our employees. Our employees' voices are in what you're looking at today. So my intent is not to expedite this really fast. My intent is to help individuals. It hasn't been a fast process for me. I can guarantee you that. I've been vetting for a very long time.
So it may not be a fast process for you, but it is a fast process for those that are gonna be most affected, all those that are gonna have, but some who need to be a substantial change in their insurance providers. Is there some kind of timeline where we have to act on this so quickly, or could this be deferred and give, employees more time to vet this new insurance?
Yeah, no, good question. So the purpose of me having this timing is because if this were to be passed with the implementation of having everyone get what they need to get by January 1st of 2026, I need to do a lot of legwork and have a lot of time for implementation with Centivo to make sure that happens as of January 1st. And that's why I'm here during this time frame. I can, if delay if the council is adamant about delaying it, I could maybe work with Centivo on delaying it for maybe 2 or 3 more weeks. But if this were to be implemented, I just want to have as much time as possible to be able to make sure everything is smooth as possible. January 1st, this is implemented.
Well, should we make sure that everything is smooth as possible
Yes.
before we approve this?
No, my thought process was I can't work on implementation until this is approved by county council, so that's why this is being presented today.
So that is what led to the final remark that was being tweeted. It says, subject to the benefits manager directly with questions and we have either received a response or that they cannot answer it until it is approved by the council. Is that correct? Does this have to be approved before you can give specific answers to a lot of the questions that people have about the changes in their?
Not at all, not at all. I've been answering them as they've been coming to me. The only thing I haven't been able to give out yet is this actual document. And that's because it was initially brought in closed session, but I did make individuals aware that if this were to be approved, I would distribute this information as soon as I could.
Alder Davis.
Thank you. I have a couple questions, well, more than a couple, but first, I need some clarity. For you say the high performance, the co-pay and plan, which one are you looking to select to make available for employees?
All of them.
All of them.
Yes, so the only thing I'll note on is the standard high deductible health plan, which is in that black box. I would only offer that to employees and retirees who do not live in Centivo's network.
Okay. Okay, I'm question for you. I would assume you are familiar with some of the staff and if they have ongoing health issues, if like this plan is actually the plan that will work with them, if there's someone that has to see a specialist 3 to 4 times a month.
Yes, correct.
And so, wait, I'm sorry, I'm going, jump it over. What, where they currently have United Healthcare, what do you have, or the, costs for specialty visits for them currently running, and what the primary care visits, what those co-pays are, can you provide?
So because of how our high deductible health plan design is, essentially employees pay first dollar until their deductible is met. Pricing for services depend on which provider you're going to. So if you go to Aurora for a specialist visit, you could see a $300 bill versus if you go to a specialist or extension, you could see a $200 bill. So there's no standardized pricing I could give you on that. But that is a benefit of the copay plan as well, where that standardizes that. It helps with financial aids and predictability when it comes to costs for those services.
I believe this question, my next question is for Sensitivo.
Matt.
What, Matt?
Yes.
Yes, Matt, thank you. So Sensitivo is actually a health insurance plan, health plan, not health insurance, correct?
Correct, yes, so we are a third party administrator, so we are not an insurance company, much like what the city has today with their current company. We're not an insurance company.
Do you, you said you and so many different areas, have you worked with a municipality of this size?
Yeah, well, say, municipality, we have a lot of public employers, so school districts, we have several counties, I don't know that have a municipality of this size, but we do have other public employers in Wisconsin of this size. Yeah.
Okay, one more question. My computer shut down. This one why I sit on my head. You speak that, Sensitivo has, criteria that they go through in order for a provider to be in your group. And there's times where a provider at a hospital may not be a part of Sensitivo. Would you consider your criteria needs your standards higher than the hospitals, or like, what?
Yeah.
Can you tell me like what?
Yeah, it's a great question, yeah, it's a great question, you've had a lot. So there's really only one generally accepted standard in medicine, and that is evidence-based medicine, right? And so Sensitivo doesn't set that standard, that's a generally accepted standard in the medical field. And so the Business Healthcare Group Coalition, so this coalition of large employers in eastern Wisconsin that I mentioned that do this study every year, they employ a third-party vendor to do a lot of very advanced data analytics. So they're using AI, machine learning, and they actually look at every single incident that primary care physician across the entire state of Wisconsin goes through. So there is a public database in the state of Wisconsin that every health plan employer submits data to. And so that data firm extracts that data, looks at individual performance, and then gives us that data and ranks each primary care physician in order, essentially. So there was a cutoff that the Business Healthcare Group Coalition felt would still provide adequate access to primary care, but would carve out those that were severely under, those stats. So it's not a Sensitivo criteria, it's a generally accepted, profile.
Thank you. The next question, and maybe for both of you, because will Sensitivo provide supplemental insurance, a supplemental plan? like extended life insurance plan or anything like that?
Oh, no, yeah, so we only handle major medical, so we
Just
do
major
not
medical.
provide, supplemental coverage.
Um, I think that's all right now, yes.
All right, Alder Perez, followed by Alder Land.
Yeah, I got a question, as far as I can remember, Ascension Hospital is the only major hospital that we have within the city limits right now. But yet your provider list for Ascension was very small and there are no pediatricians on it. Is there another list or is this if you
Yeah,
have a baby, you gotta go somewhere else?
I don't understand that, and there may be a mix up in maybe perhaps how somebody's accessing that database, because I know there was a comment made this evening, and I happened to look at the website as that was going on, and I found all of the Ascension pediatricians, specialists, for pediatrics in the network, so happy to assist anyone that might need some help using that website, but, it appeared to be working properly, and I was able to find those healthcare providers.
Does Centtiva cover functional medicine doctors or chiropractic,
Yes, of course.
functional medicine too?
Functional medicine, I mean,
Depends how you're using that definition, so we need to know exactly what you're. Well, most of the doctors we go to say, oh, you got this, let me give you some pills. Those are the functional medicine doctors go and say, this is how you get rid of this. Yeah, if you're talking about everything from physical therapy to any of the orthopedic therapies to those who are doctors, that type of thing, those are all part of the medicine.
in part of that process that was discussed about, there was a changeover, would be looking at the current benefit structure that we have today, so that we can, put those side by side and make sure that we're matching benefits, which, takes a little time to do that.
Alder Land.
Yes, I would like for you to clarify the greater north to me, is that all, just want all the hospitals in the Milwaukee and suburb areas?
Yeah, so the distinction would be basically anything north of town, so we're talking about greater south, the Legacy Hospital, south of here, the Milwaukee, and then if you can go up the shoreline in Sheboygan and Manitowoc, that's all part of what we consider greater north. So those specialties and hospitals that are in Milwaukee and in north would be part of that. Yeah.
Alder Pagel.
So I know earlier you had this, that you had highlighted the importance of the strong primary care relationship, but coming into this, I mean, you have the your company essentially saying, well, these certain 15% don't meet our standard, or at least a standard established, that maybe the hospital doesn't use it that. So I'm just, if we're highlighting that, but then we're gonna say, okay, well, now we need to choose a different primary care provider. I'm just questioning that a little bit. Now you said that the primary care provider are ones that make referrals to specialists, correct? Correct. Are they the only ones that can refer to specialists? So if they went to, I don't know, ER, could the ER doctor make them a referral, or do they have to go from the ER, make separate appointments, go to the doctor for them to then make a referral?
Yeah, that's a great question. Generally speaking, when you are discharged from the ER, typically that discharge is usually followed with your primary care physician, usually not always, but typically. So to answer that question, yes, we feel in the program that the best doctor to manage an individual's health would be a primary care physician and their staff, right? We're including practitioners, PAs in that category. Generally speaking, ER doctors are not usually ones that, manage people's overall health. They're there for, obviously emergencies. And so, yes, so when somebody needs specialty care, there are some exceptions to that. If it is an emergency, urgent care, women's health, mental health, chiropractic care, physical therapy, those kind of things, people can just, in our program, just go directly and access that care. But the program is intended to keep your primary care physician knowledgeable about your health. So if you do need to see a specialist, that primary care doctor is acting as your sort of quarterback of your health care and keeping him or her in the know of your health. So if you do see a specialist and that specialist says, I want you to go see a different specialist, yes, we want that primary care doctor engaged, so he or she knows what's going on with your health and can manage the overall health of that patient. So everything does sort of come back to that designated selected primary care physician. Now, that doctor can, you know, if somebody chooses a certain physician on day one, maybe they don't like them or it's not working out, they can change throughout the course of the year. So they could literally change every single day if they wanted to. As long as the selected primary care physician on file is the one that is managing that patient's care. But again, they could change that selection through our app, they can call us, as long as it's an in-network accessible primary care physician. That is the individual that is managing that patient's care.
So essentially they would have to see them, so emergency can determine that they have a massive tumor of some sort. They could not refer them then to oncology, they would have to go to the specialist, the primary. They would then review that and send them to that specialist.
Correct.
And then on top of that, if they go to that specialist, and that specialist says you need to see another specialist, they have to go back to the primary and they have to agree and then refer them.
Yeah, so that's the general process, is that again, in order to keep the primary care physician in the loop on someone's care. That person then is going back to their primary care doctor, and in some cases, it doesn't have to be a visit, right? It could be a phone call. Somebody could use my short messaging to send a message to their doctor, hey, I went to this specialist, they told me I should go here. Can you send Centivo referral? They may or may not want to see you. That's really up to the doctor, not us. So in some instances, it may require an in-person visit. Other instances, it may be a phone call to your doctor to let them know what's going on. And this is what this specialist recommended, but it's that primary care physician that is entering in the system for us.
So either way, if it requires 2 or 3 primary visits in between specialists, we're still having to copay each time, right?
So the copay for primary care visits on the Wisconsin 2 copay plan is free. That is a very strong piece of what we recommend is, you can't do it on a high deductible because you have to meet your deductible first, IRS guidelines. But when you take away that HSA qualification, you can offer free primary care visits for all visits. It doesn't have to be your checkup, it doesn't have to be routine type of care. It can be a diagnostic visit of your primary care physician. So on the copay plan, that would be a free visit every time.
Okay. Now, we're talking about like exceptional referrals from category or clinic, there's a process for that. Do you have an approximate average of how long that process would take? Because we are not capable of giving them the medical care that they need in their doctor. We have to go to Mayo, right? You have an average, I mean, because obviously this has come up, that's why it's in the plan. How long does it normally take to get an agreement formed that you can give them that exception?
Yeah. It's obviously every case is different, right? So to the magnitude of someone's, health issue that would, sort of, whether it's fast track or not. Dave, do you have an idea?
The reality is putting the finance agreement together, usually, it's less time than the referral itself, because if you go in the mail, getting the mail means a couple of 3, 6, 8 weeks out.
Right.
You can only have to turn it on that.
Okay. And then my next question is for Director Fisher, she will. You hear me?
Hi.
So just for clarification, I heard you say earlier that there's no overall savings for this, but our costs would go up.
Our costs would go up slightly, but they would go up significantly less than they will go up if we stay on the UHC.
$800 versus 3.2.
Yeah.
So is that just because of? Can you just elaborate more on that for me? I'm a little stuck on it. You're talking about the cost that because we're covering so much more for the employees?
So under the United Healthcare Plan right now, we have an extremely broad network that allows the employees many different providers, no primary care referral, those types of things. Also has Aurora as a main provider on our current UHC network. Aurora's services across the state of Wisconsin are at least 10% higher than any other major medical network, and Amelia can kind of cover that. But that's one of the reasons why
in the current predictions, we're saying that a certain number of employees shift over to this, how I'll refer to it, a narrower network that wouldn't include Aurora, we'd see savings or less increase because you're shifting out of that Aurora piece. So that's why you see that level of quote unquote savings, but it's really not a net savings.
But that just applies to that Aurora area.
The majority of that, I mean, I'm very generalizing it, but in general, Aurora is a very expensive provider compared to the other hospital systems.
Okay, I mean, thank you. I mean, I think as evidence by discrepancy in pediatricians, but they aren't there, maybe a little more time is needed for this, but thank you.
Alder Jorgensen.
Yeah. Yeah, on the pediatrician where you brought it up, I also just looked it up and they come up, right? But
Yeah.
and I would encourage, older put on an iPad, they pull right up on the website, it's just, that's the same link that everyone had, right?
Correct, there's one website.
Now, I will say there were, trying to pull up my location, and so maybe there was some confusion there if you guys pulled the wrong one, so there may be someone, but I was able to get it to work. I just wanted to, the primary care one, it's been brought up of, you have to go back to them. In finance and value personnel, you talked about that there were some requirements around how soon you can get seen by your primary care provider, that may be slightly different with you, right?
Yeah, so I'll address that in two ways. One is, just some general feedback that we typically hear from our members is when, they first hear about it, yes, they feel like, oh my gosh, I have to get referrals. What we find out after the fact is that most of our members find the process easier than their previous health plan. In regards, because we've all probably dealt with it, the sort of red tape of insurance companies, prior authorizations, things like that tend to hold up care. In the Centevo model, we scaled almost all that back because we know our patients are being guided by a doctor. And we feel that is the best way, again, as I mentioned earlier, to shift how and where and when people get the care they need. Is through a doctor and not an insurance company, things like prior authorization and red tape. So that, secondly, yes, we often hear a concern of, oh my gosh, it's hard for me to get a primary care, appointment today. Now I have to, so built into our contracts with providers is basically a metric that says if somebody needs a visit because they're sick, it's a maximum wait time of 24 hours for primary care. For those that are non-sick visits, so your checkups and things like that, less than 2 weeks, or 2 weeks are max time. So our partners in the healthcare hospital world understand our model. To them, they see it as a benefit, right? So it allows physicians to actually do the work that they need to do. In a situation of the plan today with high deductible, we know that people are going to avoid care because of that cost. They're gonna see the $100 cost to access their primary care physician. For a lot of people, it's a choice of putting food on the table, gas in the car, and going to the doctor. And so this takes that away and allows physicians to do the work that they need to do because people can come in a way that is equitable for everybody to access free primary care. And so again, once people get the education they need and they start using the plan, they find the feedback we get is that it's actually a lot easier than we are.
Thank you, because I think that's a point of distinction there that I think that, I've been on health plans where it's taken, a long time to see my primary care provider. So it sounds like in order to be a part of the network, they have to kind of give you the, meet the contract requirement. So they have to have people provide the appointment.
Be in not to overshare, but be in, this is transparent stuff we can share, but we contract with primary care physicians differently. We actually pay them for value versus fee for service, which is the sort of churn and burn, get patients in and out as quickly as you can and charge them. Our model says we're gonna pay you for how well you treat patients, the time spent with them, how you manage their diseases, they get the proper, vaccines, screenings, and all those things. So there's an element that those providers like better, right? That they can be paid in some cases more than what they're being paid today, but do it in a way that allows them to actually treat their patients and not just find 10 minutes to, ask how you're doing and then go on to the next patient. So yes, there is a difference in that model. It allows doctors to do their job.
And there was also some, attention brought around, you having to go back to a primary care doctor, but you brought up that it's not necessarily going back, right? You can do it through, like my chart or other things, like if I go to a specialist, and it's not, it's a different specialist you need, they put it in my chart. The primary care doctor would see that, they would simply just have to respond back saying, they approve that and you can take that, right?
Yeah, exactly. I'll give you an example, right? I go to the doctor because my back hurts. Doctor says you should go see an orthopedic. I go to my orthopedic says it's not an orthopedic issue, it's a gastro issue. You go see a gastro doc. I call my primary care doctor, okay, I went to the ortho appointment, they told me I should go see a gastro, and oh, sure, we'll send a referral to Centivo. Now I go to my gastro. This is a great example.
Thank you. Then that was a primary care one. As far as the cost goes, I know we talked about cost a bunch, but just to really simplify it. All of the projections right now for the monthly cost, the Centivo plans would be less expensive for employees than what the projection is for United Healthcare, right?
Yes, overall compared to United Healthcare, yes. When looking at it, that would be for all of the plans with the WI-2 network. So those projections, that would all be less. A reduction in premium than what we're paying now with United Healthcare. For the WI-1 network that includes Aurora with the high deductible health plan, we would be seeing probably around 4% increase, which is the dollars.
And that's the difference there, that's the one that has Aurora.
Yes, correct.
So I guess that was another one, because I completely understand, concerns from employees of, what is this going to do monthly, especially when, we don't have the concrete numbers to give because we're still too early in the process, but hearing it is very confident that, very confident to say that right now, Centivo will be cheaper monthly than what it will be with United Healthcare. I think it's a big deal because, a lot of attention gets put on, oh, this is saving the city money, which, there's some discussion there, I guess, but as far as the employee goes, it's going to be saving them money as well, too. I also want to call out, you had mentioned at the beginning, and we talked, I think, more at finance and personnel about this, that this is something that you repeatedly have been told, when we had UHC, that pretty consistent feedback was, why are you only offering one plan that's a high deductible plan? Can you give some more on that feedback? Because I just think that's kind of why we're here, right? It's not the cost, it was mainly that you started before we got to the fiscal cliff that's been discussed. This predates all of that, right?
Yes, absolutely, yes. There were two major, I guess, categories of the concerns that have been expressed to me since I've been in the benefits manager role, starting in 2021. One is, it's very limiting to have just one high deductible health plan as a medical insurance option to pick from. There's no option. And employees appreciate that. They want options in the medical insurance decision that they would like to make for themselves as an employee of the city. And the second being the employee wanting a medical insurance plan that has lower costs for that. So having the lower deductibles, the $200 deductible, the $400 deductible, and having the prescription copays kicked in right away, that's a huge way to address those concerns. So yes, it's been mainly focused on having more than one option and having those lower out-of-pocket costs for our employees.
Thank you. And then the last one that I wanted to just clarify on was the discussion on, if I have a specialist that I'm seeing now that's maybe outside of the network, what does it look like?
if we switch over to it with reasonable, is that something that, is that something that you're kind of going above and beyond for, I guess, I'm just trying to put it there, if we had switched to somebody else other than Centivo, that's not typically an industry practice, right? No, more so there's like there's a harder cutoff, at least from what we talked in finance and personnel, that it sounds like it's a very movable goalpost from your standpoint, right?
Yeah, certain health plans have, their own sort of varying criteria around that. I've worked for all the major health plans, and this certainly tends to be a broader definition and sort of allowance of that here. Now, again, I want to be very clear, this is not for everyday specialty care. These are things that are, sensitive, they are severe, but, things like mental health, right? But that, you wouldn't typically see that in another health insurance plan, but yes, it really is reserved for, again, the pregnancies, the advanced cancers, some of the more severe type of care.
And there's chronic illness going that, like if it's like a really specialized chronic illness that there's, maybe not a lot of specialists for it, someone where, it is more rare, you've been with this one specialist for a while, that there be.
We look at all that, absolutely, absolutely.
Yes. Thank you so much between all the deep dives we did in finance and personnel on this to now. This is a decision that I really don't take lightly at all, but I look at it through the lens of what I want to be on this plan or not. And where I really got hung up on what snagged my sweater was that we offered one really expensive plan right now, high cost deductible plan with no flexibility to it. If I was an employee, I would be frustrated with that. I've never worked in an employer that only had a single plan that was a high cost deductible. And so the idea that we can get what looks to be at every facet better care, with lower cost to employees, lower cost to the city as well too, with some pretty good flexibility from Centivo. It looks like it's one of the rarest cases of it. It's a win-win all around. There may be some differences of now you've got to go through a primary care provider, but we've heard a lot of promises on how primary care providers are under contract to get you in consistently faster. There's requirements around that. I guess my promise to the employees would be that as an alder would be that we're gonna hold HR and Centivo to the promises of, if there's ever anything that maybe isn't working out the way, I'd encourage you to go work with them first, but I want to be a resource that this isn't just done and over with. There's going to be a transition, especially with the timing piece. I know it's been brought up of, is this being rushed through? If it's not done now, the longer it gets delayed, the more bumpy that transition is probably going to end up being. So it's looking like it's a win-win all around. And so by delaying it, we're going to just make it harder on you and harder on the employees as well too, because no one wants a bumpier transition. So that's, I guess, where I get to it. It looks like it's a win-win, and I get full commitment that if it doesn't go like it's been promised between Centivo and HR, I'll be the first to want to get back involved again to figure out where we want to track it.
Alder Mack.
Thank you. Not a question as much as a comment. Change can be unsettling and something that we all deal with. When I go back a few years, and I remember when the city, the county, and Racine Unified and Johnson Wax, I believe it was, got together and they hired a third-party administrator. I don't believe it was UHC at the time, but I was working for the county and I was affected by that. And being that those entities are self-insured, our insurance costs are variables that are pretty well uncontrollable. If we have a number of employees or even just one employee that has a catastrophic illness, they can spike our costs in any given year. So you hope and pray that everyone stays healthy and you don't have any anomalies there. The And as a county employee, I remember we switched to UHC and there was some apprehension, you know, what's this going to mean to us? And the insurance that I have today through the county is not the insurance I started with in 1990 when I started with the county. And I can assure you that the insurance that employees have today is not the same insurance that they had in 2001 when I started my first stint as an alderman. And so we're discussing these changes, and I think we're doing our due diligence tonight, and we're asking good questions. In some ways, I think we're getting down into the weeds and maybe some hypotheticals that are anomalies versus the day-to-day average impact on employees. We can what if all we want about, you know, catastrophic illnesses and chronic illnesses and things like that. But it appears that there are plans in place to be able to deal with that. The other advantage, and it was brought up once, but you know, okay, even on my insurance plan, which is not Centeva, I may have difficulty getting into my personal care provider, and it's not because of insurance or the, it's because they're full. They are seeing patients and there are only so many physicians out there and much more, patients than. So there are going to be times when that obstacle is. But the advantage our city employees have, our county employees have, our city unified employees have is we have that wellness center. And I'll tell you right now, I utilize it for the prescriptions where I don't have to pay $10, $35, $50 or $150 for my prescriptions. Maybe 2 prescriptions I'm on that they don't carry, but the other ones they do. And boy, it's convenient. And if I was a city employee, I'd be taking advantage of that as a supplement to the insurance. I've called up and I've utilized the physician, their physician assistants there. I've utilized them for some things where, you know what, I don't want to pay a deductible or whatever to go see my primary physician. It's something that I think they can handle. And so, is this plan perfect? No. Is the UHC plan perfect? No. But, what I like about this is it offers another option, and that's a lower cost option to our employees. Thank you.
Alder Davis for a second time.
Thank you. Question is for Matt. Being that you are a health plan, who is your health insurance carrier?
These are self-funded health plans, so the city today is a self-funded health plan, and then they carry what's called stop loss that we've discussed, so it's catastrophic. Claims, you know, high cost claims, there's an insured product that sits over that, but we are only a self-funded health plan, so we are not, an insurance company.
Okay. And, sorry, oh, you may have mentioned this, but normally, like, it comes around September, October, the price from, say, UHC, you know, from insurance carrier. Are we only able to work with one plan or insurance carrier to figure out what works best? Because what I'm going is, we say that we don't know what UHC is yet. And they don't normally give their prices out about September, October. What if they come out and their prices, they're, you know, are not as high as we are expecting it to be, and are actually, better than Centevo, and we're able to keep what we have?
So I think you're referencing premium amounts, is that what you're referencing? So self-insured, we don't pay a premium per person enrolled to an insurance company. Self-insured, we pay the cost for medical insurance claims that are incurred by the individuals enrolled in the plan. So we don't get, we don't get pricing from a TPA. We have actuary services that put together what the premiums should look like. Oops, excuse me, sorry. I just got a word sickness, I'm so sorry. Based off of a number of factors such as administrative costs, from the TPA, what it costs to administer the benefits, stop loss insurance, what that renewal looks like, and a number of other factors, but it's not necessarily a premium we're getting from someone. It's something that we project based off of the city's costs. If that makes sense. So I typically we do get finalized numbers towards October. So which is why we typically introduce it within the budget process.
Thank you.
Otherwise,
Thank you. Just a question in regards to the premium. So with the one high deductible plan, everybody, the single family pays the same?
So if everyone who's enrolled in a single pays the same monthly premium, and then everyone who's enrolled in the family level pays the same monthly.
Whether you live in the city or,
Correct.
so there's no delineation between if you're a city resident or not. As far as the premium. So my question is in regards to the plans that people would opt into. I imagine that the low deductible would have a high premium. And the high deductible would have a low premium, correct?
So actually what we're looking to do is have the copay plan, the low deductible, have a lower premium than the high deductible health plan on the WI-1 network. And that's because the copay plan has a narrower network. It doesn't include the middle. So the monthly premium for that copay plan is gonna be lower than the high deductible health plan that's on the WI-1 network.
So what would the incentive be to have the high deductible?
Aurora Healthcare. If someone is really tied to an Aurora Healthcare provider, they're gonna look at enrolling in that WI-1 network with the high deductible health.
Well, I'm talking about the WI-2. So there's two WI-2s. There's one that has the low deductible, the 200, 400, and there's the one that has the 3,500, 4,000.
Yeah.
So their premiums will be the same in both of those.
So the high deductible health program, WI-2 network, that's gonna have the cheapest premium. So that would be the incentive to go with that.
So my question is, what are you looking at? Are you looking 4 times as much, or half as much?
It would,
And how does that compare with the current premium that's the high deductible for everyone?
yeah, no, good question. So between the two, there would be about a 2% difference.
That's it?
Correct. And then across the board, it ranges anywhere from 6.6% to 8% lower in premium than what we're paying today.
We being the city? Or we being the
The employees, yeah, the employees, or enrolled.
any other questions? Okay.
Just real quick, on the second two with the higher deductible, how does that compare to the premium that's being paid today? I understand it's lower, but is that one is?
Oh, for the WI-2 high deductible?
Yes, I call it the second time.
Yes.
Maybe 76%.
Yeah, so we would see about an 8% decrease in premium.
From what I would have now on a similar, same deductible with UHC.
Other questions? Okay, our thanks to HR and the team for putting this presentation together. Now we can go to the finance and personnel report. Alder Land, I'm guessing this is an item you'd like to request for separate consideration.
Sure.
If you could please read that item.
Item 0542-25, communication sponsored by myself on behalf of the Human Resources Benefit Manager, requesting to appear before the Finance and Personnel Committee to discuss employee healthcare and plan design options. Recommendation was to approve as presented. Move to approve.
Motion to approve this item, seconded by Alder Farman. We've had lots of questions and discussion, but this is an item that is on the floor. If people would like to discuss this further, it is on the floor to be able to do so. Any further discussion on this item? Alder Davis?
Thank you. I would like to speak against the motion and ask for it to be deferred. So there's a lot of information that was provided now. Although I've watched the Finance and Personnel Committee meetings, there's still everything that is coming out. Wordsmith, I'm a individual that likes to read and see it in writing. So not just about me, but I'm wondering if we can defer it so that we could possibly get these items in writing so that we can make a proper decision for the employees and racing and not make a haste decision. That's just.
So if you'd like to formally make the motion for the item.
Make a motion to defer.
And that is in order and has been seconded by Alder Wider. So now the motion on the table is whether or not to defer the item. Any discussion on the motion to defer? Alder Jorgensen.
Yeah, I'm all for pausing things if there's outstanding questions, but I really haven't heard anything from that was presented tonight that was, we need to get back to you. It pretty much answered all of the questions. And it seems like by deferring it from what we've heard tonight, we're only going to be harming the employees by potentially making it even harder transition. So when I hear that, you know, premiums are lower, the care below Brian is higher, and no outstanding questions, unless I missed something, but none of the presenters tonight gave I'll get back to you, we can't answer that tonight. It looks like, it would be we need to move forward with this so that we're not making the transition even harder. Because as far as getting anything in writing goes, this is a publicly recorded meeting, so everything is on the record. There's no way to go back necessarily on that.
Alder Davis.
Thank you. As I stated, my learning curve, my learning difficulty is in just hearing word. I would like to read the information that was presented to us. So it's not about us having to have ongoing questions, but it's actually to take a moment to digest what was presented to us so that we can make clear call on what we are deciding for the employees. Health insurance is not something you just say, okay, we heard it, and yes, we're going to agree to this. I feel that just do, and I believe we were said that 2 to 3 weeks would be okay for it to be deferred. So that we were able to sit and I will say I, may not be others, so that can sit and actually read the information that was presented to us. So that we are making the proper decision for the employees. I received several emails and calls regarding individuals that are not happy with this change in plan. And this is just my first hour time seeing this information here. I would like to take a moment, take the time for our next one to read this information. And I'm sure others may want to take a moment to read it and actually know what we're deciding on folks' health insurance plans. It's health insurance is your life.
Alder Pabon.
Thank you, Your Honor. I believe Alder Pete had his hand up before me.
Oh, I'm sorry.
If I could,
Yeah, Alder Pete, I might be there, sir. Alder Pete, yeah.
My question is, can we is that information even available at this point? That might be great if we could, but I'm not sure if it's even available for someone to speak to that, because it's more like a proposal that's being put together at this point. So I
guess I'm looking for the city administrator or someone from HR to try to clarify what additional materials might be available.
I think they have the materials in front of them. It was provided by Amelia that has the chart and what's included in each plan. I don't know what additional information Amelia would provide that she hasn't already provided to Finance and Personnel and all the different departments in every presentation that she's done.
Alder Pete, you still have the floor.
Thank you. That has pretty much answered my question.
Alder Pavone.
I just, I'm not against, deferring it a couple of weeks, because I think if, was it Amelia? I apologize. If she had seen that there were any substantial harm to taking it out another 2 or 3 weeks, she would have told us that. That's her own words, not any of ours. So I think a couple of weeks for us, just to make sure we're digesting any more constituents to reach out. And us to maybe, if there's no more information to be presented, we can at least email and make sure like, oh, okay, I just want clarification on this. On the whole, yes, lower deductibles, this all sounds great, and we have to really focus on what's sustainable for the city, right? Because we want to continue to take care of the people that help our city run. But I don't think it's unreasonable, especially when the person that's been working really closely with this is telling us maximum 2 to 3 weeks. And then I should be able to still get the implementation done, so.
City Administrator.
Yeah, I'd also add, and I don't know if Amelia at this point really know, but one of the available plans is literally the exact same plan that they have right now. So if you need to come back, what you want to do is remain stay in the high deductible plan rather than the co-pay plan, which costs less. As is somewhat restricted, and we see somewhat restricted, really the only thing that is missing is the Aurora system. But if you don't want that and an employee wants to keep what they have, that is exactly an option that they can continue to have the exact same plan that they have right now.
Alder Harmon.
I guess I have a point of information. I don't, were there presentations offered to city council members by this entity prior to tonight that all of us could have come to and get additional information and answer constituents' questions and provide questions of themselves?
Yeah. So it's a good question. That the timeline was first introduced in closed session with finance personnel to sort of give permission to begin the process, right? And then from there, HR did countless meetings with departments on work sites and individuals who had specific questions. And then at the last finance and personnel committee, there was another sort of about hour-long presentation that's available on Legistar for people to watch. But for people who were at FMP, they were there to ask those questions and have them answered. And I know HR has made themselves available to elected officials, to employees, to others. I don't even want to guess how many actual one-on-one meetings or workplace meetings Emily has done in the last 6 weeks, but it's been substantial.
So when I hear someone say that this is the first time that they've read something like this, it's not the first time that there's been opportunity to understand this prior to tonight. So there is the possibility that anyone who has insurance currently, they can keep it the exact same way, or they can get something that is cheaper, or they could have attended several of the meetings that were offered before. I think that this is a good plan. I will be voting against deferring this.
Other council.
First, I just want to really thank Amelia for all the work that she put into this, all the presentations, everything like that. I'm speaking in favor of deferring for now, just because there was a lot of questions going into it that it seemed like employees still had, not due to lack of effort, but just a lot of employees. And I think a lot of those questions got answered tonight. So I think it would be beneficial to now have time to re-talk to all these employees and, regather their input on it, because at the end of the day, I'm not voting on my health insurance plan, I'm voting on other people's. And so for that, I personally will be in favor of deferring this for now.
Alder Jorgensen.
Yeah, I think Alder Harmon pointed it out, but I just want to reiterate, it is not the first time that this has been provided to the council. This has been given multiple times at finance personnel. And so that's one, but two, I just wanted to clarify, it had been brought up, 2, 3 weeks, there's no harm in that. There was a word of caution of it will make it more challenging, right? HR can back up and just either correct me if I'm wrong on that or say that yes, an additional 2-week delay will make this harder.
Yes, when speaking with Santino, I initially in the writing process, I asked, what does implementation look like? What does the timeline look like? And based on that answer, that Santino gave me, that brings me to this date, this meeting for the reason of making sure I can have everything in place and have as smooth of a transition as possible for January 1st. Their words were, we can do it if you start in August, but it is going to be harder than if you were to start, as soon as possible, as soon as you can. So I know we are only talking about a couple of weeks, but those couple of weeks can make a significant impact. And would allow me to just provide the best experience possible if we do implement this.
Thank you, because I wanted to make sure that I was remembering that right, that it was, can it be done? Yes.
Yes.
But it is gonna add more risk and challenge to it, and so, thank you.
Yes, absolutely.
All right, there are several people who want to speak on this. Alder Kelly.
I have a question for Amelia.
State your
What is
question.
your open enrollment?
It is November 1st through November 30th.
Okay. Last year, we had some things that kind of felt a little bit rushed, especially when it comes to healthcare. And again, a lot of people here have said that. It's such an important decision when you're talking about current employees and retirees. And thank you for all the work that you've done on that. I'm sure you've done a fabulous job. For me personally, I could not attend the closed session because, I was at work. So the only information I had available to me was the last session, which I listened to, and I didn't have all the answers that you gave tonight. So thank you for that. I too would like to have more time to digest this because it is a huge decision. Last year, we made a very kind of rushed decision on a Medicare plan. And afterwards, there was a lot of pushback, and I felt like that probably should have had more of a time of discussion. I think when it comes to insurance moving forward, I'd like to maybe see a committee of the whole where we could actually have these discussions before we have to quickly make a decision. So, I know there is a little bit of time because open enrollment is, and I understand the setup process of that. But I would be in favor of giving ourselves a little bit more time so we can actually make an informed decision for the employees, the ones that actually have to have this insurance.
Alder Mack.
Thank you. I'll say it again, most people don't make change. Very few employers in this community discuss their health insurance options out in the open like we're doing. And I'm gonna guess that very few employees actually have the ability to lobby the board of directors for or against the changes that are proposed to their health insurance. We have to do our due diligence. But the bottom line is we are self-insured. When somebody goes to the doctor and the insurance company doesn't pay it, that deductible isn't covering the insurance company's cost. We're essentially getting a bill for all of those doctor's appointments and for those specialist visits and so forth. We've been presented with a change that feels significant to the employees. And the most significant change is the loss of Aurora. But we've heard that the costs for Aurora are 10% or more higher than everyone else in the network. I'm gonna be voting against deferring. Even though open enrollment is in, what was it, November, you said? It appears that in order to work with Sentiva, that we need the time to be able to properly implement it. I believe our benefits coordinator here has been forthright with us. At times, she shared from her heart regarding the challenges that she's seen and heard from employees regarding high costs. And we are offering something that wasn't offered in recent times, and that is a low cost alternative to the high cost deductible. So I'll be voting against deferring, and I'm prepared to vote this evening. Thank you.
Thank you. Alder Widener.
Thank you. I had no idea that the mayor was going to call for a presentation from the benefits manager and from the salesperson from Centevo tonight. I had every intention, and I had asked the chair of finance to call this item out because I wanted to refer it to the committee of the whole, which I think is the appropriate place to have had the presentation and a full and robust discussion. Here we are, almost 2.5 hours into a council meeting. We spent the majority of this time discussing something that should have and could have been fully vetted and discussed in the committee of the whole. The beauty of the committee of the whole is it would give all the aldermen an opportunity, as Alderman Davis is asking for, to digest the information that we were given tonight before we make the final vote. Had we had a committee of whole on this, we would have had a time period in which we could have made a determination before making a final vote. I am in full support of deferring this item for a short period of time so that the aldermen that are voting on this can feel comfortable that they're making a good decision for the employees that we represent. So the only question I would ask, and that would be the maker of the motion, is what the intent is. Will this go back to finance, or will this come back to council in 2 weeks?
The motion on the table is to defer, not to refer.
Oh,
So,
defer back to council in 2 weeks is the whole motion.
So I'm just speaking in favor of that. I think that is an appropriate thing for us to do it.
Next in the queue is Alder Pete.
Only question, first of all, I also want to thank you for all the work you have put into it. But would the delay affect potential cost structure? Could it affect the prices that the city has to pay or the employee or anything like that?
It wouldn't come down fast, no.
Thank you.
Alder Davis, your second.
My last comment, I just wanted to clear some things up. This is the first time I'm having this in my hand and my first time looking at it physically. I paid thank you for this information. I watched the finance and personnel meeting online on YouTube, and it's what the PowerPoint wasn't clear so that you can actually see the information. So if you were not in the closed session or in the finance and personnel meeting, you would not have seen this information up front, as I did request and sent emails and asked for it. But I received it here, so I'm appreciative of receiving it here. Thank you kindly.
Alder Burns.
Just, I'd like some clarification from the city attorney about a comment that was made about our discussion. Alderman, Jorgensen said, this, what we've discussed here, we can always go back and look at for intent and so forth. But that's not true, because unless it's codified, it doesn't apply as rule of law. Is that correct?
Well, the council, if approving this item, would be passing a resolution. A resolution is an enactment of law of the common council. So, and the common council could always have a communication for someone to come back and provide another presentation on how it was implemented or something like that if they wanted.
I don't think, maybe I didn't ask that right. The fact that we don't have the actual numbers in writing. What numbers were discussed. If we pass something now, for numbers are not actually written down. They can go back and be changing those discussion was to keep it a certain way, is that correct?
You're talking about the premium share
Or whatever,
the amount?
it just, the discussion doesn't necessarily mean that what we pass is correct, because if the numbers and if the information is not codified in writing, it can always be changed, is that correct?
The premium is never determined until later in the year, irrespective of the plan that exists. So, if the common council were to approve this, the question is approving these plans with this health, this administrator's third-party administrator. That's what's before the common council. The issue of premium and premium share isn't before the common council right now. And under no circumstances would be before the common council until October or November. Even with the plan we have, that's just not, the timing doesn't affect that.
Yeah, but again. I'm confused now with your clarification, because I don't think that's what I'm asking. The point of what we discussed orally. Does not have effect of law unless it is written down, is that correct?
Well, it's the record of the common council, and there are minutes of course that are entered, and we have a recording of what's going on. So that is a matter of record, but what you have in writing is the plan design for the entire health insurance program. So that is in writing. The parameters of insurance are so complex and would be hundreds of pages long of exactly everything that's covered. But the insurance plan is not changing. It's a third-party administrator and co-pays and out of pockets and things like that. That's what's changing. The insurance plan continues to be the city's health insurance plan, self-insured health insurance.
Okay, thank you.
Under Pete for a second time.
Real quick, I think some of the confusion here, first of all, I spent more years than I'll admit in the health insurance business or financial services. But I think there's three things here. First of all, Robert Mack has referred to several times, we are self-insured. This third party administrator has somewhat of a different business model. Which is different from working with UHC, which is a health insurance company. So the only thing, I guess I'm reiterating what the attorney said, that we're voting on tonight is the third party provider. That, as the question I asked before or pointed out, additional information, and I respect what the other people said, but the additional information is based. We can't really get much because we don't have a policy anyway. The city has a policy if you want to use that type of language. Am I correct? It makes sense? Because it's not, if I buy health insurance from United, I get a policy, all the benefits and a lot of the items I think Alder Perez might have been referring to would be contained in that policy. But you're the insurance company. The third party is the administrator, which is all we're voting on tonight, which might be causing a little confusion.
Correct, yeah, so, yes, so to clarify. Essentially, we're looking to have an approval of moving from United Healthcare to Centivo as a third party administrator. And looking at implementing these plan designs that are on this document before you. So that is the intent of the item today.
Any other discussion? Just as a reminder, what is before us is a motion to defer. When the clerk calls your name, please, again, so this is an item to defer this item until the next council meeting, 2 weeks, right? It's technically 2 weeks in a day from today, because we're meeting on Wednesday, 2 weeks from now. So that would defer a vote in favor of this motion defers this item until that next council meeting on August 6th, I believe it is. So if you vote yes, that'll be deferred. If you vote no, we will go back to the main motions and then vote August 5th. That's the Tuesday. Yes, Wednesday, August fifth, my apologies, is when it would be deferred to. If you vote no, and that were to carry, then we would go back to the main motion on whether or not to adopt the item before us. So when the clerk calls your name, please vote as you wish.
Alder Horton,
Aye.
Alder Skata. Aye. Alder Pete,
Aye.
Alder Land. No. Alder Perez.
No.
Alder Kelly,
Aye.
Alder Harmon,
No.
Alder Pabon,
We're voting on whether to defer.
Yes.
Yes.
Alder Frazier,
Aye.
Alder Townsend,
Aye.
Alder Davis. Aye. Alder Mack,
No.
Alder Jorgensen,
No.
Alder Widener.
Aye.
Nine ayes, 5 noes.
Motion carries. This item is deferred until our next council meeting on August the fifth. Back to the finance and personnel report. Alder Land, did you have any other items for separate consideration?
I do not.
Then without objection, these items will be added to the consent agenda. Alder Wiseman,
I just have a question on one item.
state your question, state the item and then your question.
Item 0651.
State your question.
Well, my first, I'm trying to remember, was this item discussed in closed session at the PSL? This was in regards to the condensed collective bargaining of public safety employees. Was that in closed session?
Closed session. It was in closed session and open session at finance and personnel.
Okay, then my second question is, I need my memory refreshed. I did not believe in the past that the city administrator was doing the negotiating, for the bargaining. I thought that was the city attorney.
Yeah, the ordinance was changed 2 or 3 years ago to name the city administrator as the lead negotiator.
Thank you. Changed.
Seeing no other questions or comments, the remainder of these items will be placed on the consent agenda. We'll then move on to the report by Public Works and Services Committee. Alder Mack, did you have any items for separate consideration?
No, sir.
Then without objection, this report in its entirety will be placed on the consent agenda. Moving on to the Public Safety and Licensing Committee, Alder Widener, did you have any items for separate consideration?
I have two.
Please state the first one.
The first item is 0620-25, communication on behalf of the city clerk's office submitting the statement application for Wayland Zoo for the DBA Lucky Wayland Zoo therapy located at 9 State Street. I believe the applicants were here. I'm sorry?
They left them.
So I assured them that there would be a separate vote by this body. So therefore, I'm calling this item out for a separate vote. The
Right.
recommendation of the committee was to deny the license based on information that was provided.
And so that is your motion to deny?
Motion is to deny.
Okay, there's a motion to deny item 0620-25 made by Alder Widener, seconded by Alder Pabon, affirming the recommendation of the Public Safety and Licensing Committee. Alder Widener, would you like to speak to your motion further? Any further discussion on Alder Pete?
Yes, I would like to point out that after speaking with the applicant, there is some communication issues here. I'm not sure if those communication issues became part of the problem with her people she did business with. But I think I had a communication problem understanding exactly what she was saying. And I don't want to be too eloquent here because I don't want to get into specific details. But as the applicant spoke this evening, she did point out that she wasn't the person that was doing any advertising, which was one of the items that we were looking.
Alder Kelly.
I stand by, the vote that we made in the committee. This establishment or applicants, I should say, didn't show up to the first meeting when the two different ones were on the agenda. I had spoke with, the investigator after and provided some additional context, but what we were provided from the sheriff's office, I think that any establishment that or applicant that has ties to human and sex trafficking, that is a very serious thing. And I would think that in our community, that's not something that we.
Other discussion, Alder Harmon.
I was able to attend, the committee meeting, and I think that the committee did a really good job in getting the information, asking specific questions. If the meeting was handled appropriately, the recommendation to, not give them a license, I completely agree with their assessment and how they handled it.
Other discussion on this item? Seeing none, again, just to remind everybody, the motion is to deny per the committee recommendations the license. So if you vote yes, you're voting to deny the license. If you vote no, you would be, because it doesn't, not, it'd just be voting not to affirm it. It doesn't make the license go into effect. That would have to be a subsequent motion. So again, a yes vote is to deny the license. A no vote is to not deny the license. When the clerk calls your name, please vote as you wish.
Alder Horton.
Aye.
Alder Escada. Aye. Alder Pete.
Yes.
Alder Land. Aye. Alder Perez.
Aye.
Alder Kelly. Aye. Alder Harmon.
Aye.
Alder Pabon.
Aye.
Alder Frazier.
Aye.
Alder Townsend.
Aye.
Alder Davis.
Aye.
Alder Matt.
Aye.
Alder Jorgensen.
Aye.
Alderman Widener.
Aye.
14 ayes, 0 noes.
The motion to deny carries. Alder Wider, do you have another item for separate consideration?
I do, thank you. That would be item 0662-25, presentation, permitting a new cigarette, tobacco, and electronic vaping device retail license application for Savant Inc. DBA Staff Link located at 1305 Washington Avenue. Dr. Missouri Lion, agent. I think this application was listed as the first district, but I believe it's the second district. Third district. So the recommendation of the Public Safety and Licensing Committee was to approve.
The motion is to approve. Is there a second?
Second.
Seconded by Alder Pete. Discussion on the item. Alder Wider, did you want to speak to your motion? Alder Kelly?
Yes, in the committee, there was a little bit of confusion as to the district that this particular establishment, after the application is in. So I do think it would be fair to hear from the alder of the district, and what their opinion of this establishment is.
And we landed on it being in the third, correct?
Yeah.
Alder Davis, would you like to speak?
At this point in time, the ordinance that we created for it to come before PSNL seems to be formality. And so we don't have any reason why we can't deny it, but, I am not in support of vape and tobacco store right now in Uptown. That's all.
Okay.
Yeah.
All right, so the alder of the district, that should have some weight. Any other discussion on the item? Alder Jorgensen?
Yeah, this is something that I have a deja vu on, but in consistency, I really do place a lot of weight in the alder, representing the district, and so. We just heard tonight that the alder is recommending no. I trust she has her reasons and, whether that's hers and her constituents, but, representing the Westboro district, I would go along with her with no.
Alder Pete?
I think there's miscommunication.
We need the city attorney.
But under the law,
Yeah.
we can't deny it, and I thought I heard you
Yes,
say.
exactly.
Yeah, we can't deny it, we don't have the grounds, I'm sorry.
So, Alder Pete, it's okay, I'll ask,
Sure.
the city attorney to clarify our agency or lack thereof in this matter.
Thank you. We do have an ordinance that requires the issuance of cigarette, vaping and tobacco products to come through committee to the common council. But I don't want to say it's a formality, but state law completely preempts local law when it comes to cigarette, vaping and tobacco license. And we'll just read the language of the legislature. The uniform licensing of cigarette, electronic vaping devices and tobacco product retailers is a matter of wide concern. The city, village, or town may only adopt an ordinance regulating issuance, suspension, revocation, or renewal of a license only if the ordinance strictly conforms to this section state law. So what the state law is saying is whatever the state law is in issuance of a license is what you have to do. There is not discretion to deny a license because, for example, I don't like cigarette smoking or I don't like vaping or something like that. The only way that a license could be denied is if the applicant doesn't properly apply, doesn't pay the fee. If the applicant has prior revocations on existing licenses for instance, selling tobacco to children, selling loose cigarettes, knowingly allowing criminal behavior on the premises, and so on. And if there's on the application, if there's a material misrepresentation, or there's conviction of a substantially related crime, it's issues like that. That's the only time a tobacco license, broadly including vaping, may be denied. So, my mind, we don't see any of those issues in this case, so the council does not have the discretion to refuse to grant the license.
Just to clarify on Alder Pete's point, then, if this motion were to fail, the license would move forward.
Right, because the recommendation of the committee was to approve.
Okay. But it would create a record that the council objected to the license being offered, but it would be, I don't want to say symbolic, but it would create a record of what at least the council's intent is. Okay. But there's nothing functionally that would stop this from moving forward, given our preemption understood.
Right, well, we do have an ordinance that requires the council to actually grant tobacco licenses. Except, and I know this sounds odd, but the council doesn't really have discretion to refuse to grant the license. In some ways, I realize some people may call it a formality, but at least the committee of the council knows when tobacco and vape licenses are being applied for and where they're going to be, and the ordinance being in place, which is a relatively new ordinance, allows at least that knowledge to be there.
Alder Jorgensen and
Yeah.
Alder Mack.
Well, thank you everyone for the clarification there. So I'm not on public safety and licensing, so this is outside of my wheelhouse. With that, I still understand the Alder from the third's point, and I guess I'm with you in spirit on if you feel this isn't a good fit for your district. You know, your concerns were noted and they didn't go on deaf ears. I heard them as well, so.
Alder Mack.
There used to be a adult bookstore on Main Street. And every year that license would come before the council, and every year I'd vote against it. And one year, a number of aldermen started to follow my lead on that one. And I sat there and said, oh, no. Because if the council rejects it, it puts us, at the time, we were told it's gonna put the city in a bind because the council can't technically reject it, but we would be. I'm like, I'm gonna have to go back and change my vote if it fails. Because, you know, I was standing on principle. And I applaud the alderman, for standing on principle. I encourage her to vote against it. I do not like the proliferation of vape shops all over the city. I think it brings our city down. The same as those, instant loan places years ago that started, popping up all over the place. But I'll be voting for it because I don't want to put the city in a bind of having the council reject it and then possibly, if the attorney isn't correct and the council action actually prevents the license from being issued, then having that applicant sue us for causing us all kinds of grief. But I encourage her to vote against it.
Alder Pavone.
I thought that we were working on getting clarification from the city's attorney's office regarding whether that, what we actually have as far as jurisdictional power, whether it's regarding to regulating signage or anything of the sort. I know attorney, I always say his last name, Attorney Ian, he had stated, like omission and or conviction. Like the only two reasons, none. So I just want clarification here, like, I know you talked about it earlier, but. Is there more for, like, other than conviction, like, that's broader, right? Do we run a background check on this, on the people, even when they do the national applications, I would assume so.
Well, if there's some misrepresentation in the application, or they didn't pay the application fee or something. But if there's a conviction that's related to that. Somehow.
Okay.
Those are the bases for denial. I'm not aware that any of those problems exist. And it's in effect a ministerial duty that the common council has to approve it. If the common council were to deny, essentially you're telling staff, don't issue the license. But then the applicant would be in a position to have a potentially legal complaint against the city. I'm not suggesting they do have a viable complaint because I realize that it's public and reporting, but that's an issue. So,
thank you.
Any other discussion on this item? And this is item 0663-25, whether or not to approve the preempted item of tobacco license. When the clerk calls your name, please vote as you wish.
Alder Horton.
Aye.
Alder Escada. Aye. Alder Pete.
Aye.
Alder Land.
Aye.
Alder Perez.
Aye.
Alder Kelly.
No.
Alder Harmon. Abstain. Alder Pavone.
No.
Alder Frazier.
Aye.
Alder Townsend.
Aye.
Alder Davis. No. Alder Mack.
Aye.
Alder Jorgensen.
Aye.
Alderman Widener.
Aye.
10 ayes, 1 abstain, 3 noes.
The motion carries. Alder Weiner, did you have any other items for separate consideration? Then without objection, those items will be placed on the consent agenda. And we will move on to the Transit Commission report. Alder Horton, was this an item for separate consideration?
No. I guess so now.
Okay. Please read the item.
Okay. All right, 0649-25, communication sponsored by Alder Horton on behalf of the Transit and Mobility Director, repealing resolution 0067-23. And requesting permission to replace the manufacturing bus procurement quantity, providing authorization to execute an agreement to purchase 3 Gillis 35 feet EV fixed route transit buses for approximately $4,500,000. Recommendation that the mayor and city clerk be authorized and directed to execute the agreement to purchase 3 Gillis 35 feet EV fixed route transit buses for approximately $4,500,000. Fiscal note, the total approximate cost of the vehicle replacement project and workforce development program is $4,500,000, with the grant amount being $3,800,000. Local match, $700,000 available in the capital plan under 602820115731082006.
Second.
The motion and a second to approve this item. Discussion. Alder Weiner.
Just have a couple questions about this item. From the transit manager, and can you tell us what the total cost of the vehicles themselves are?
Yes, they're just over $1 million. Then we've got, the workforce training program associated with the grant, which is $250,000.
So each of the buses is $1 million?
Just slightly over 1.2.
So is there something special you need to help these electric buses?
That is the market. That is how much this product costs.
I just Googled it, and Madison just bought EVs for $673,000, so I guess why it's so costly for us. And the other part of it, I wonder, because EVs cost so much more than diesel. And the electric buses actually have less of a lifespan and less usage. If this is really, this grant is used for diesel rather than EV.
So I'll start with the most important part of your question, which is the usage for the grant. This grant has to be used towards EV vehicles. So we don't have flexibility around how we apply these funds as we wrote for the grant for EV vehicles. So secondly, Madison, I can't speak to the situation in which they paid for their buses, but of course, there are many different factors, quantity, manufacturer, that in the like, so. But in front of you today is the purchase of 3 Gillig buses along with the workforce development program associated with training our technicians on those buses.
And can you tell the council what that workforce development training actually is, and what that entails?
Sure, yeah, our first round of workforce development training is having a technician on site who walks through the technology with our mechanics and is on site for a certain period of time, making sure that it's not just a class session where it's hands off the bus. So you're gonna have somebody on site who's going to walk through how to make sure that you maintain the technology. So that's something that we've experienced before, and we're looking forward to that with this new manufacturer.
Wait, the last, and that's 200,000, did you say?
Allotted for 250,000.
Correct. So we're gonna have it, for how long will that technician be there?
Well, we can negotiate the length of that time, but we'll want to make sure that we get the most out of that. So, our last program is a year.
So 250,000 per year?
Yes.
Okay. Last question on that is, how long can the EV, operate on a shift?
Sure, so we have our EV buses that operate during peak service, so they can operate throughout the entire day, operating on peak service with one single charge. So our longest route is about 120 miles on peak service. The EV bus can do that, so dispatching it out when we have more buses on the road during 30-minute service, and then when they're back at the garage, sending them back on the road at the evening shift. They can sustain the entire day without having to plug it in the middle of the day.
So unlike a diesel bus, they have to go back to the garage and be recharged after a very short period of time of usage, right?
Well, no, so we have less buses on the road when they're not in peak service. So we dispatch our electric buses during peak service because we have no buses on the road. And we know that that's the route that they can.
Thank you.
Alder Kelly?
Hi, thank you for getting back to me so quickly. I appreciate the explanation. If you could just maybe reiterate what you had told me, the information to the rest of the council.
Sure.
About the bus line.
Alder Kelly's question is, do we have to accept these funds? And the answer is yes. This council approved us to apply for these funds. This council approved for us to accept these funds. The item in front of you is approval for changing the manufacturer for the purchase and use of.
Okay, and then could you just speak to, you had explained about the service life of some of these buses, you said are 12 years.
Yes, so the buses that they will be replacing are buses that we're gonna need to replace anyway. That have been in service for over 12 years, that have over 500,000 miles of service. And so we're going to have to pay to replace these buses, and we have grant funds to do so. So that means we wanna be good stewards of taxpayer dollars and take advantage of those grants.
Alder Price?
Yeah, Director, in the past, you've been cannibalizing one of the EV buses to replace the parts on the bus. Have you run out of parts to cannibalize? So we need 3?
No, so we have a fleet management plan. So the fleet management plan assesses how many buses you have, how many years they've been in service, how many miles they've been in service. The Federal Transit Administration provides guidelines for how to manage your fleet, which says that they need to be at least in service for 12 years with 500,000 miles. So when we have buses that have reached their useful life benchmark, we look to replace those buses with new buses. And my objective is to make sure that we leverage federal and state resources to reduce the burden on local property taxpayers. So that when we do replace those buses, the feds and the state are paying for the lion's share of that. So this is an example of that.
So what you're saying is that you're replacing the older buses, not replacing the current EV buses?
That is correct.
Good, I see. All right, thank you.
Alder Jorgensen.
Yeah, I just wanted to, reiterate, I think that that's the point that really, sets this in stone, that we're not approving the switch to electric buses tonight, that's already been done. This is just switching the manufacturer for the brand that we've already got, right? And I would brought up about Madison, I just did a quick look, looks like in 2022, they bought 27 electric buses for $41.6 million. I'm guessing this is an industry that economies of scale is really big part, and so us ordering 3 is pretty different than a much larger city in Wisconsin with a much larger order. Okay, thank you.
Alder Devon.
So on this grant commission, I want to clarify that we're just doing this because we had such a manufacturer because the previous manufacturers.
The previous, thank you for providing space to answer that question. So the previous manufacturer has decided to not produce 35-foot buses. So they're in a space where they're only producing 40-foot, 45-foot buses. And we're not going to purchase about that size. We can't fit in the garage. Doesn't make sense for the scale of our transit system. So because of that, we're switching manufacturers to, utilize the grant and get new buses.
And because this was already approved to be done for the fleet, and this is specifically $3.8 million, right? Of the grant to go towards electric vehicles, we could use this for diesel if we want. Correct, okay. And side note, there was a comment earlier by public comments about trying to get something changed to accommodate the new social security office, which I know the last mission I believe was Route 21. Route 27 that we did because otherwise they would have to try to cross Washington, which is dangerous to drive on, let alone to walk on. So that will be accommodated to make sure people have public access to the new social security office. Besides, but thank you.
10 times a day on the weekdays.
Just to be clear, the item on the calendar is to accept a grant, not to discuss new routes. To the social security office, we're running a bit of field of what's on the agenda here. Alder Perez.
So, Director, I know that in Public Works, we piggyback onto Miami-Dade's garbage can production cost, and it lowered our cost significantly. Is that something we do too also in our program?
Excellent question, Alder Perez. This is being purchased off of the state contract, so we do better.
Okay, seeing no further discussion on this item, when the clerk calls your name, please vote as you wish.
Alder Morgan.
Aye.
Alder Skata.
Aye.
Alder Pete.
Aye.
Alder Land.
Aye.
Alder Perez.
Aye.
Alder Kelly.
Aye.
Alder Harmon.
Aye.
Alder Devon.
Aye.
Alder Frazier.
Aye.
Alder Townsend.
Aye.
Alder Davis.
Aye.
Alder Mack.
Aye.
Alder Jorgensen.
Aye.
Alderman Widener. Sorry, can you repeat that?
Aye.
Thank you. 14 ayes, 0 noes.
Motion carries. We then move on to the planning heritage design report. Alder Pete, is this an item for separate consideration?
No, I do not have.
Okay. Then without objection, this will be placed on the consent agenda. Moving on to the CDBG advisory board report. Alder Pete, do we have any items for separate
Point
consideration?
of order, Mr. Mayor.
Yes.
I don't believe Alderman Pete is on that committee, so why would he be the one referring this?
Which one? You are correct. CDBG advisory board report should not be made by Alder Pete. He is not on that committee. We're trying to figure out who the, Alder Horton, would you like to read that report?
Yeah. Say it again?
Alder Horton, you were at the meeting, correct?
Yes, I will.
Okay, and have you had any requests for separate consideration on the CDBG advisory board loan?
No, yeah.
Then without objection, these will be placed on the consent agenda. That moves us on to the consent agenda. At this time, I would entertain a motion to approve the consent agenda. Multiple motions to approve the consent agenda. Is there a second?
Second.
Multiple seconds. All those in favor of the consent agenda, please say aye.
Aye.
Opposed? That motion carries. And we now move on to common council announcements. Alder Perez.
So, Your Honor, we've had a very difficult week, as there was a press conference earlier today about the homicide and I just want to remind the community it's very important to maintain safety. The police are always gonna be able to get there at time. There could be a train crossing the railroad tracks. They could be on the other side. They could be on the other side of the city handling another incident at the same time. So it's very important to use common sense and be prepared. Don't be out in the middle of the night if you don't have to, or late at night, you know, do your own check around your house. If you do see a problem, please call the police department. They'll come and handle it. Don't handle it yourself. You know, go in your house, go into a safe room. We're gonna bring a phone with you, but do not take those unnecessary chances. Call the police department, call the fire department if you need to, but please use common sense. And this doesn't just happen in our community, it happens in all communities. We have to take care of ourselves primarily first. And our first responders are really our backup system, because they cannot always be there for us. So if you need training in those areas, training is available from the police department, from myself, from the fire department. Any of those things, we'd be more than happy to help you with any of those issues. Please reach out and with me in particular, be happy to take care of some of those issues. I specialize in some of that training as well as our police department and firefighters. So you have to take caution and you have to be alert and you have to take care of your own safety. Don't depend on the city to do it for you. They're really your backup, but don't take any unnecessary chances. It's not worth it, okay? Run, hide, fight is the last alternative, always. Hide, you can run away. If you're not in a fight, you're not gonna have a problem. And there's no shame in running away, okay? It's very important to remember that. So take those steps, be careful. We've gone to those trainings. We'd be happy to help you with that as well. Thank you.
Other announcements? Alder Cabell?
Just piggybacking on what Alder Perez said, condolences to the families affected by the senseless tragedies that have gone on, and the numerous, shootings that we've had. And also big praise to our police department that were really stretched for the 4th of July and now into this and the fantastic work they do, Chief Ramirez and so on and so forth. And just remembering that it's okay, to assist when you feel when it's okay, as far as if police are asking you questions, because if it was your family member, you would want the same. So we all have a responsibility to keep ourselves safe, our families safe, and then our community safe as well, by cooperating with police officers, doing overseeing neighborhood watch, whatever the case may be, taking advantage of what's available to us to make sure we remain livable for everyone, in our city here. Second thing is, today is my niece's 11th birthday, so happy birthday.
Happy birthday to her. Any other announcements? Alder Davis?
Thank you. Happy belated birthday to my niece, she's turning 18. And then I would like to mention Girls Inc. is having a canoeing and canoeing and kayaking trip for high school girls on Friday, July 25th. Check out my Facebook page or Girls Inc.'s page if you will be interested in coming out canoeing at the Racing River Education Environmental Center. I might have missed something. But yeah, and it's free of charge. You just have to register.
Any other announcements? See none, at this time, I'll go ahead and entertain a motion to adjourn.
Second.
You gotta.
That's one of these points.
Yeah.